Welcome, everybody. Thank you for joining us on time. It's a pleasure to have you. Welcome to our event, Building a Stronger Future, Strategies and Practices to Establish Effective Coordinated Response to Address Domestic Violence. As you all know, this is such a crucial topic. We all know how multi-agency work is important in the field of gender-based violence. However, how to implement that in practice is usually much more challenging. And I'm really happy that we are using this space and this conference to hear both from policymakers, but also practitioners about their experiences and good practices in doing so in different countries. My name is Sandra Jovanovic-Belotic. I am Training and Capacity Building Manager at the European Network for the Work with Perpetrators of Domestic Violence, and I will be your moderator today. European Network is the organization that focuses on ending gender-based violence through working with perpetrators, and we unite more than 70 perpetrator programs across Europe in more than 30 European countries. It would be really nice to also hear from you and know the country and the organization that you're coming from. How are you feeling today? So this is a warm invitation to introduce yourself in the chat. So as you know, we have a really interesting event planned for today. We will start with a presentation from Ms. Pedra Nil, who is policy officer at the European Commission, and she's gonna speak about the European agenda to prevent and combat violence against women and girls. And then we continue with our colleagues Elena Gaiotto and Berta Wall, who will present more in-depth experience on the implementation of the project, which is called ASAP 2.0. And this is a project that focuses on comprehensive strategies to tackle perpetrator work and also has strong element of multi-agency work. After the presentations, there's going to be a space for you to ask questions. So please make sure that any question that comes to your mind, that you put it in the chat during presentations, and then we will make sure to address all relevant questions. Then we will have a short 10 minutes break, and we continue with really exciting presentations which focus on how multi-agency can be applied in different settings. So we will hear from different projects, for example, Change, that focuses on integrated territorial approach. If we can move the agenda to scroll a little bit. And also, we will hear about the specific of collaboration and multi-agency work with police authorities and different services. And then finally, how what are the good practices and experiences in ensuring multi-agency collaboration in cases of violence against older women, and we will hear from the Marvo project. So this section is really interesting because it focuses on how we can apply multi-agency work in different contexts, different settings, and with specific target groups. As always, there's going to be space for your questions, so please make sure to point any dilemmas or questions that you have and put them in the chat. There's going to be enough space for you to take care of yourselves, to have lunch. So we will have a 15 minutes lunch break, and then we continue with really interesting panel discussion. And we will hear from organizations who have been implementing ASAP 2.0 project and learn more about the specifics in different countries and how they adapted the approach so that it fits the needs and the diversities in different local communities and countries. So that's going to be a really interesting panel. After that, again, there's a space for your questions, answers, and again, a short break. And then for the last part of our event, we will move to Zoom, and it's going to be really smooth and easy, and you will receive all the instructions that you might need. The idea is that we will be able to work in small groups, exchange and interact, and to speak about different experiences across Europe on different topics such as collaboration between victim support services, perpetrator programs for effective risk assessment, how do we ensure child safeguarding when we address domestic violence issues, and also to think about the digital dimension of violence against women and what are the practices and good tools that everyone can share to tackle this specific issue. One of the comments that we are usually receiving from all participants is that it's really important to have a chance to interact and to meet colleagues from different countries. So I really invite you to also take the opportunity and join us for the last session of today. Okay, so as you could see, we have really interesting and exciting day ahead of us. Please make sure that you put all the questions that you have in the chat. And with no further ado, I would invite our first speaker, Ms. Pedra Neal. Ms. Neal is a policy officer at the Gender Equality Unit of the European Commission. And as part of this team, she contributed to the directive on combating violence against women and domestic violence, and also recommendations on harmful practices. And one of her areas of specific expertise is gender-based cyber violence. Ms. Neal, thank you a lot for joining us and taking the time, and the floor is yours.
Thank you very much, and thank you for this introduction and for inviting us and giving us the opportunity to talk about everything that the European Commission is doing. I prepared a very small PowerPoint that I'm going to try to share now. So if you're talking about gender-based violence and everything that the European Commission is doing to combat gender-based violence, first and foremost, we need to talk about the gender equality strategy. The gender equality strategy went from 2020 and 2025. It's almost like our Bible or the source of all our policy. And it contains all the key priorities that this commission wants to do to obtain a union where women and men, girls and boys in all of their diversity are free to pursue their choice and path in life, to have equal opportunities to thrive, and to equally participate in and lead our European society. In other words, to have a gender equal society. And one of the first priorities, actually the first key priority that's mentioned in the strategy, is combating gender-based violence. So this strategy confirms the commitment of this commission and of our president Ursula von der Leyen to do everything it can to prevent and basically eradicate gender-based violence to the best of our abilities. Because obviously we're not that naive to think that with this equality strategy everything will be sorted out, but we believe that it allows us to take big steps towards this goal, because it provides for an ambitious set of measures for ending gender-based violence against women and domestic violence, some of which I'm going to highlight now. So first and foremost, very important is finally the accession of the European Union to the Convention of Istanbul. So the EU already signed the convention in 2017, but it took us until October 2023 to actually accede for it to enter into force. So now the EU is also bound by these ambitious instruments and by comprehensive standards to prevent and combat violence against women and domestic violence. Unfortunately, for very complex legal reasons, the EU is only bound by some aspects of the convention, so not all of them, but the aspects that also apply now to the EU are in the area of judicial cooperation in criminal matters, asylum and non-refoulement, and with regards to public administration, including funding, policy, and legislative matters. This is very important, especially because some of the member states unfortunately have not acceded to the convention yet. But by the fact that the EU is now member, these member states will indirectly also be member, because there was a court case already that said that the Convention of Istanbul is now part of the obtained acquis in the EU. So member states have to oblige to it, at least when it comes to these limited matters. We are now still in the process of figuring out how this exactly will work. There's still some discussions going on the voting rules, on the funding, how Grevio is going to analyze if the Commission is living up to all its obligations under the Convention of Istanbul. So we're working with all stakeholders there to make sure that the EU is as bound as possible by this. So this can be an additional instrument to hold everyone accountable for their policies. A second very important deliverable under the gender equality strategy is a directive on combating violence against women and domestic violence. Actually, I should say proposal of a directive, because the directive has not been formally adopted yet. The proposal was adopted by the Commission on the 8th of March 2022. Ever since, there have been very intense negotiations between the co-legislators, which led to a political agreement in February earlier this year. And we are expecting Parliament to vote next Wednesday, and then Council is going to vote a couple of weeks after. So we're hoping it's going to be the first half of May, maybe mid-May. And then there's some procedures and formalities to follow. But we hope they will enter into force in the summer. But then again, you have a 3-year transposition time, so it will only have real effect in 2027, which seems very far away. But still, we're very excited about this directive because we believe that this is going to be a huge milestone in combating gender-based violence, as this is the first legal instrument that in a holistic manner focuses on these matters. It does so by firstly criminalizing certain forms of violence against women and domestic violence. These include female genital mutilation, forced marriage, the non-consensual sharing of intimate images, including deepfakes, cyberstalking, cyber harassment, including doxing and cyberflashing, and cyber incitement to hatred or violence based on gender. So the first part of the directive is really focusing on giving these definitions that are going to apply throughout the EU, because there are going to be minimum standards that all member states have to obtain by, so that no matter where you reside in the EU, at least going to have a minimum set of rules, rights, I mean, um, regarding protection if you have been victimized. But obviously, we always encourage member states to go even beyond the minimum set of rules. Secondly, the directive also focuses very much on prevention, protection and support of victims, and better access to justice. And under this protection chapter, there is one very specific provision on intervention programs, which are programs that perpetrators can follow, or at least people who are at risk of offending or reoffending can follow. So it can be, for example, if you already offended, and it can be obliged by court, but it can also be voluntarily. But it can also, it's also open for people who themselves feel the need to follow this kind of program if they fear that they're actually going to become offenders. So that was very important for us. And there is in this provision a specific focus on offenders of rape. There's also other very important provisions under the chapter of prevention regarding the need to promote the central role of consent in sexual relations. There's going to be multiple campaigns. Um, yeah, but we still have to going to see with member states how they actually implement that to make sure that these provisions also really change something in the field. I think that's the most important for the directive. Even though we don't have the directive officially yet, we already know that the directive is not going to cover everything, unfortunately. That's why we're already working on a recommendation on harmful practices, which is going to complement the directive. This recommendation is going to be on preventing and combating harmful practices against women and girls, and it's planned to be adopted still this year. Like the directive, this recommendation will take an intersectional approach to address the more specific needs of people at risk, so at higher risk. So there's going to be intersectional discrimination, but also regarding the directive, politicians or journalists. This recommendation is going to address some harmful practices that are also covered by the directive, but also other ones. So the recommendation is going to cover female genital mutilation, forced and early marriage, so child marriages, honor-related violence, forced abortion, and forced sterilization, and other harmful practices that disproportionately affect women and girls. How is it going to do that? It's going to give recommendations. That's why it's called a recommendation to the member states on how to deal with this kind of harmful practices. There's going to be very generic recommendations on a higher level, then more horizontal ones, and then very specific ones for this specific harmful practice. What we also have installed under this gender equality strategy is a prevention network. The prevention network, the idea is to bring representatives of member states together and give them a platform for them to allow to exchange good practices, to lessons learned, to also address new issues, because sometimes it's always good to hear from people, more local people or NGOs, to learn about the problems in the field. So this prevention network comes together twice a year. It first time came together in November 2023, and just 1 week or 2 weeks ago, it came together again, so in April. And the focus there was on engaging young people, in particular men and boys, and role of education and digital media. Because every time that the prevention network comes together, they themselves give inputs for a topic they want to discuss and debate on. So first time it was more about primary prevention, and now it's more about engaging men and boys. So this allows them for everybody to discuss these topics in a very informal manner, because there's only two people from every member state present. You have a fixed member who is most often someone from the government, and then the second person is invited depending on the topic, and NGOs are there present as well. And the outputs of these exchanges, we're looking for it to become more concrete. There may be trainings, capacity building, support services, and so on. Oh yeah, sorry, I forgot the slides. We're also doing other things. We are still going to work on a code of conduct on cyber violence. This code of conduct is going to focus more on the social media platforms themselves. So it's going to be less with civil society and less with member states, but more with the platforms, to see how to deal with cyber violence and how cooperation can enhance the prevention also of gender-based cyber violence. And we also have the mutual learning sessions, which is member states hosting other member states, a representative from other member states. And again, a topic is chosen where the people present can discuss this topic and come up with reports and so on. So this again allows this collaboration, which is very important for the Commission, because sometimes we notice that there's so much happening in member states, and member states are doing most member states are doing their best already, but sometimes they get a little bit stuck and they don't know what the issue is and how to advance. So with this legislative measures, the non-legislative matters, and enhancing cooperation and facilitating cooperation, the Commission really tries to fight against gender-based violence in every way possible. We will have completed basically everything from the gender equality strategy. We're already looking at what next steps are, such as, for example, the transposition of the gender-based, the directive combating violence against women and gender-based violence. I think that's the most important thing for now.
Thank you very much, Petra, for sharing all the indeed important work that Commission is doing. I think it's important for all of us, for member states, for NGOs, for organizations in the sector. And I think that we are all looking forward that directive is adopted. And I'm glad to hear that you're already working on filling the gaps like this through these recommendations and the code of conduct on cyber violence. And thank you for sharing these news and updates from the European Commission.
My pleasure.
Thanks a lot. And also thank you for being available to take any questions if there are, and for finding the time to join us in the event.
Thank you.
Thank you. Goodbye. Okay, so now we move on. And after the presentation that focuses on the European agenda, we will now hear from Elena Gaiotto. Elena Gaiotto comes from Italy, from the organization that is called Una Casa per l'Uomo, and she's vice president and project manager in this organization. And furthermore, she was coordinating ASAP 2.0 project, so she knows all the details about the project and policy recommendations, but also how it was implemented in each country. So, Elena, thank you for joining us, and the floor is yours.
Thank you so much, Sandra. This ASAP project is, a long adventure that started in 2018 with the first round of the project. So I will try to squeeze all of these years into 20 minutes of presentation. So during the project, we have developed a methodology which is called the ASAP methodology, and it is a model for a systemic collaboration between perpetual programs and victim support services, and it's based on the integrated community response approach. It's kind of obvious, but the goal of each and every action that we do is to increase the safety of women and children that are involved. And this is the basis of every step and of the process of the collaboration. So we didn't invent anything new, because the collaboration between perpetual programs and victim support services is written in every piece of regulation that we have, going from the Istanbul Convention that says that programs for perpetrators are set up and implemented in close coordination with specialist support services for victims, to, for example, the last standards that were developed in Italy by the government that say that perpetual programs maintain ongoing functional relationship, including through the signing of network protocols with all institutions dealing with violence. And you can find more information about all of this in the European recommendation for perpetrator work in multi-agency collaboration that we have developed during the project. So as you see, all regulatory sources underscore the need for integrated work, but unfortunately, there are no operational guidelines or methodological references on how to set up this collaboration. So when we started working on this with the first ASAP, we started, thinking about all the potential challenges that there are in setting up a collaboration between perpetual programs and victim support services. And this goes, here you can see a few that we found that go from the, all the challenges related to the exchange of information between the services that, can induce the fear of increased risk for women or distrust regarding the use of information. But it's also sometimes we still see skepticism by victim support services about the effectiveness of perpetual programs or about the possibility of change in the perpetrator. We have also seen other challenges in setting up the collaboration, because what we didn't know when we started working, what kind of topics should be discussed between the two services, and what are the shared goals about collaborating and setting up meetings. And also, for example, the doubts about what kind of tools related to assessment and measurement could be used, and focused on what? Recidivism, risk, change. And above all, one of the main challenges was to set up a collaboration that was sensitive to all the privacy and ethical issues regarding the exchange of information and the safety and security of victims. So we were, at the beginning, the question was, is it possible to set up a collaboration? And the answer was yes, it is possible, provided that we define and adopt a common procedures that need to be sustainable and feasible. That means that can be easily integrated into the processes of organizations. They need to have a really defined structure, but need to be flexible enough to be adapted to the diverse situation and context of each country, but also of each case. They need to have bring results that are describable and measurable, and the procedures need to be known and recognized. So with this in mind, we started in 2018 the ASA project that had the goal to define and test a model for systemic collaboration between the two types of services with the ultimate goal of increasing the safety of women and children. We tested the protocol in Italy, Croatia, and Bulgaria, and we then disseminated it across Europe. The results of the first SASA project were encouraging. So because we saw after the testing and implementation that the average number of the impacts of violent behavior decreased significantly over time. We also saw that the average amount of high and intermediate risk reported by case managers decreased over time again, and that we had the feedbacks from the professionals that were using it were very positive because the protocol was helpful in fostering the cooperation and increasing the safety of victims and somehow, reducing recidivism. So these results were encouraging, but we still saw a few challenges related above all to the management of ethics aspects of privacy and security of data shared, and we needed to have a more wider implementation. So we decided to do another project to upgrade and update the protocol, and we have done this since 2022. Okay, perfect. So we started the project with the partners that I want to thank. So Association NAIA from Bulgaria, SPAVO from Cyprus, EWO from Greece, and WWP. And we were very ambitious with the goals and impacts because we wanted to test the protocol to see an increase in the effectiveness of treatment programs. We wanted to see the reduction of violent behaviors and the recidivism rates and risk levels for victims and for children. I'm not going to spoil Berta's presentations, but we have in fact achieved all these impacts, which is really important for us. So regarding the model, what is this ASAP model? It is a protocol for collaboration that can be activated in cases of domestic violence and IPV in particular, when both members of the couple, ex-couple, so the perpetrator and the victim, are attending their respective program. And this protocol can be activated between the two services, but can also be activated including other territorial agencies that are involved in the case, and can also be activated if the perpetrator program has the partner contact. The model of collaboration foresees three different phases of collaboration. The first one is the preliminary. It consists of a preliminary meeting between the full staff of the collaborating services. And this meeting has the goal to establish the collaboration based on mutual trust. It's fundamental to have the professionals know each other on a personal level, but also to confront and share the different methodologies and views that may have been. As you remember before, I said that one of the challenges is that still many support services do not believe in change of perpetrators, but also in the effectiveness of perpetrator programs. So this first phase is fundamental for the ongoing process. Phase two consists in regular meetings between case manager, that is the professionals working with the perpetrator and the victim. And these meetings are held more or less every 3 months. And during each of the meeting, we have defined a set list of topics that need to be discussed. The first one is the assessment of risk that needs to be done jointly. Then we have the assessment of recidivism and of individual change through the impact toolkit. And then the last part of these meetings, which is, I believe, really important, is joint planning and decision making. After we have also phase three that comes when the case is closed and we do the follow-up. Now I'm going to tell you, about all the tools that we have included and then regards the topics that I've listed. So the first one is joint risk assessment. And as you can see here on the right, we have prepared a dedicated tool for risk assessment that includes items that related to risk for the woman. But another part, which is really important for me, is the section B, where we have a series of risks for the children, because the protocol not only focuses on the safety of the woman, but also of the children that may be involved. The risk assessment needs to be done separately by each professional involved and then shared and compare it during the meetings to come to a sort of joint risk assessment, and it's to be repeated every time before each meeting. This is important because in case of high risk situation, the professionals involved can promptly respond to the situation. From the perpetrator's perspective, this is really important because it provides information that can be used to improve and adjust the treatment program. And for the victim's perspective, this helps fine-tuning safety plans. As you see in the orange bubble here, this is feedbacks that we have from professionals involved. And they say that the use of common tools for risk assessment facilitates both the detection from different perspectives, but also the identification of items they may not receive enough attention. For example, digital violence that is also included in the items of the assessment. Another tool that we have included is this simple tool for the assessment of recidivism. And as you can see here, the tool foresees that professionals record the episodes reported by the perpetrator, by the victim, but also by other agencies for all these types and categories of violence that, as you can see here, also include cyber violence and violence against children. And this is important for the joint detection of recidivism episodes, and it integrates the victim's perspective that is sometimes lacking when we work with perpetrators. And it's important because it enables a more accurate assessment of both individual behaviors and episodes related to those types of violence where recidivism is less immediately detectable, for example, like psychological violence, but also where recidivism is less perceived and reported as such by perpetrators, for example, economic violence. Another tool that we use in the ASAP toolkit is the impact toolkit, which, as you know, is a standardized tool that used to evaluate the changes in perpetrators' behavior, the impact of such behavior, and the changes in victim safety. And it consists of 5 questionnaires for the perpetrator and 5 questionnaires for the victim to be administered at 5 points in time that correspond to the phase 2 meetings of the ASAP protocol. And it's really important to have the impact toolkit within the ASAP toolkit because it facilitates a shared definition of individual change goals, not only regarding high risk of recidivism or lethality, but also goals related to change in the perpetrator's behavior and relationships. And it helps perpetrator focusing on parenting abilities. The last part, which is really important for me, is this case management tool that we have included. So you can see in the part on the left, after each meeting, professional record all the results of the assessment that have been done. But also you see in the action plan on the right, it's important that during each meeting, professional agrees on the protection and support measures that need to be taken to increase the safety of the victims, and then record the deadline and who is responsible for their actions. And this is very useful because it provides a precise timing of the commitments made. It allows for multi-party monitoring and shared assessment of what has been accomplished. And I would also say shared responsibility on the actions. So the ASAP 2.0 protocol was updated to include all the aspects that you see here that goes from COVID-19 that was then changed into emergency situations, cyber violence and stalk aware, child protection and recidivism. And we will talk about these aspects later on during the panel with my colleagues. But we also, one of the most important things that we introduced in the protocol is a tool to define ethical and procedural issues that arise from the sharing of information. And this is what we call the multi-agency standard agreement, which is a document that needs to be signed at the beginning of each collaboration case by the professionals involved. And it addresses the critical issues that are involved concerning confidentiality and privacy. And we introduced it after the feedbacks that we received during the first project by support services, but also at the beginning of this new project during focus group that we had from them. The document, the MSA, formalizes the collaboration, making it structured and not sporadic, and it identifies the parties responsible for collaboration, assigning responsibility to be carried out every time. The MSA defines all the important aspects that regarding the collaboration. The first one is related to the consent of the victim that must be explicited in written and must be confirmed each time there is a meeting. And it also regulates the exchange of information and what information can be shared and with whom. And it also provides a part where each party involved, commits to the collaboration through this mutual commitments part. That can also be assigned by external agencies, like, for example, social services or child protection services, police, judicial system that are involved in the case and that should be included in the collaboration process. In some cases, for public agencies, it was not possible to sign the policy, the MSA, because public officers do not have the power to sign documents of that kind. So we introduced this policy document, which is a confidentiality agreement. And the goal of this document is to ensure that professionals working with victims and perpetrators agree upon minimum standards of collaboration to enhance the efficacy of coordination and maximize safety. So this is what very, very quickly the introduction to what is the methodology of the ASAP. And we have been testing it extensively for over a year in the 4 countries involved. And we managed to involve 82 perpetrators and victims with 81 protocol meetings. And the good thing is that we, the 4 partners involved, also managed to engage 37 external professionals from 60 organizations that go from victim support services to police, to social services and child protection services. So this is really important for us that we had the chance to test the protocol not only internally to the organizations, but also with external organizations. The ASAP methodology had also a huge impact with the trainings that we had, because we managed to train nearly 400 professionals from 163 organizations, most of which were victim support services. And also all the dissemination activities that we have been doing, that we are still doing, have had more than 800 people register to the events, which is a lot for me. And another funny thing is that we had people registering from 6 continents, and we were only missing the penguins from Antarctica to have them all. So apart from the numbers that you see here, this is important for us because the ASAP methodology is very simple. And it talks about the collaboration between support services and perpetrators programs. It is, for us, it is nothing new because we have working on this for more than 5 years now. But it's important for us to see that it is a topic that is really rising the interest around Europe on this subject. And it's important for us to keep working on this. And that's it for me.
Thanks a lot, Elena, for, I would say, really inspiring presentation. As someone who worked a lot in the practice of perpetrator programs, I can relate with all the challenges in establishing cooperation with victim support services that you have mentioned. And also, I can recognize this from supporting programs across Europe. And as you know, one of the key challenges that Grivio pointed out when monitoring how the Istanbul Convention and specifically Article 16 is implemented in different countries was exactly this one, that there are challenges in ensuring cooperation between perpetrator programs and victim support services. So it's really good to see that it raised such a huge interest, and I think that you managed to develop really clear and simple procedures, as you said, that are also really practical. So I'm sure that many of our participants today can think about using it and getting in touch to have more information about this. So thanks a lot, Elena,
Thank you. Thank
for
you, Sandra.
your presentation. And this is again an invitation to all participants to put any reflections or questions that you have in the chat. And I think that the resources that Elena was mentioning are already shared in the chat. So this is something that you can access to. And now when we had an overview of the ASA project and impact of the ASA project, we will continue with the presentation of Berta Val from the European Network for the Work with Perpetrators of Domestic Violence. Berta will also talk about ASAP 2.0, but she will focus on findings, challenges, and lessons learned in the implementation. And Berta is associate professor at the Blanquerna University in Barcelona, Spain, and she's also research and development manager at the European Network. She has extensive experience in research of gender-based violence, but specifically programs for perpetrators of domestic violence. Berta, welcome. It's a pleasure to have you, and the floor is yours.
Okay, so thank you very much for the presentation, Sandra. And also, I'm very happy to do this presentation just after my colleague Elena, because I think it has shown very nicely the different tools that were available, and now I can really focus on the results. Also, when I was now listening to Sandra's comments about Grevio, pointing out that one of the main challenges that still exist is specifically the collaboration between perpetrator programs and victim services. I was also thinking that another challenge that we will tackle now, that also Grevio mentions in the reports, it's the evaluation of these programs and how do we assess impact of these programs. So we will show also today how we have tried to assess the impact of the protocol establishment and also of the programs themselves. So I hope this also helps to shed some light on this challenge that we know that still exists. So as it was just said, I will explain the main findings of the implementation of the protocol, some of the challenges and also lessons learned. First, I will very briefly explain the methodology and tools that we have used. And this is going to be very brief because, as I have just mentioned, Elena has already made a very nice overview. Then I will focus on the program outcomes. And with that, I mean the outcomes of the perpetrator programs that have participated in the protocol. Then I will very briefly review the results of the implementation of the protocol. And finally, I will describe or discuss some lessons learned, conclusions, and maybe also steps forward. So, as it has been mentioned, when we try to assess the impact of the establishment of the protocol, we discuss a lot about which outcome measurements we should consider or take into account. First of all, we thought it was important to consider the change in the violent behavior and also a change in the impact of this behavior. It's very important that when we assess the outcome of a perpetrator program, we don't just consider the change in the violent behavior. I mean, this is important. It's very important that the violent behavior is reduced and stopped. But we also have to consider the impact of this behavior because, as you know, sometimes the violent behavior might stop, but there might still be an impact of this behavior on the victims. So we still have to consider this impact when we assess the outcome. Second dimension for us, very important when we assess the impact of the protocol, is to also assess the safety of the victims. So what is the level of safety for the victims? And finally, we also wanted to assess the quality or the usefulness of the protocol. So that's the three main dimensions that we have considered when we did the evaluation of the implementation of the protocol. So what did we do? As you know, also it's very important that when you assess a specific dimension of outcome of or impact, that you consider different sources of information, because as you know, this project really focuses on collaboration. So the evaluation of the impact also has to have the information from the different targets or the different persons, that professionals that have been involved in this collaboration. So when we assess if there has been a change in the violent behavior, but also a change in the impact of this behavior, we considered the accounts of the men in the program, but also the accounts of the partner or ex-partners of these men, so from the victims. And we also consider the information from the case managers. When we want to assess safety, we consider the same information or the same informants, so men in the program, partners or ex-partners, and also case managers, so we can compare how safety is perceived across these different actors. And finally, the quality and usefulness of the protocol. Basically, we ask the case managers because they were the main informants and the main applicants of this protocol. So which tools did we use? This has been already very well explained by Elena. Basically, to assess the behavior change or the change in safety from the perspective of the men in the program and the partner and ex-partners, we use the Impact Outcome Monitoring Toolkit. You can find more information in our website about the toolkit. I'm not going to explain in detail, but Elena has already reviewed the main ideas of this tool. And then to assess behavior change or changing the impact of this behavior from the case manager's perspective, as Elena has been mentioned, there's this collaborative assessment of recidivism that was done jointly by the case managers. And then for the safety, the assessment of the safety, we use this risk assessment checklist for victims and children, very important from the case manager's perspective. And to assess the quality and usefulness of the protocol, we used a questionnaire that we designed specifically for this project, which is the questionnaire for assessment of change in organizational behavior. You can find all these tools in the protocol, as Elena also mentioned. And then also, as you know, many of the outcomes that we are measuring here are not static, they are dynamic. Risk is dynamic, also behavior change is dynamic, and the impact also changed throughout the program. So we decided to do this assessment at different moments to be able to, as Elena was mentioning, not just perceive the process of this change, but also to be able to take measures if there is, for example, an increase in risk. Yes. So this is basically the approach that we followed in the methodology, and I will now focus on the main results. First of all, I will mention the program outcomes. So the outcomes that focus on this behavior change and the change on the impact of the victims and survivors. As Elena has mentioned, in the first ASAP protocol, we obtained good results. So we were very expecting to get good results also for this implementation. And as you can see, this was pretty much the case. Although violence stated by the partners or ex-partners is consistently higher than the one self-reported by the men. So in all the times at the beginning of the program, during the program, and also at the end of the program, if we compare the proportion of violence that is stated by the men in the program and by the partners or ex-partners, usually the partners still perceive more violence than the men. But still, even if this is still a reality, we also see that there is a statistically significant decrease in emotional and physical abusive behavior over time, so throughout the program and throughout the application of the protocol, according to both. And this is very important because this is not just according to the men in the program, which can be more or less expected, but also to the partners or ex-partners. So also they say that there is a decrease, an important decrease in the emotional and physical behavior, abusive behaviors at the end of the program. For the sexual abusive behaviors, we don't have a statistical significant decrease, but this is also because at the very beginning, the sexual abusive behavior was already quite low, probably because of low rates of recognition or acceptability. So that's why we don't have a statistical significant decrease, because in all times it's quite low. Then another very important result, talking about integrating different views, we also obtained the result that clients and partners or ex-partners views were more similar at the end of the program. That basically means that at the beginning of the program, they had very different views about the violence. So there was no agreement about which type of violence occurred or with which frequency. Also about the impact of violence. So they were not agreeing on the impact that the violence of the men has had on the victim, and also on the levels of fears. So there was consistently less recognition of all of these items by the men in the programs. And at the end of the program, the views become much more similar. So they agree more on what has happened, the impact of what has happened, and also the fear that this has caused to the victim. Also, the impacts of violence on the partners or ex-partners are reduced significantly, again, statistically significantly, according to the partners or ex-partners. And this is very important. So also the partners say that not just the violence has reduced, but also the impact of this violence has reduced very much for them. And there is also, and this is also very important, we added this perspective, broader perspective on children also in this second ASAP protocol. And we obtained the result that there is also an increased awareness of the impact of violence on the children. So both become more aware of the impact that the violence has had on the children. And this is very important also as an outcome, as a result. So other program outcomes, we measure behavior change and impact of this behavior, and then we also measure recidivism. And we measured this recidivism at different time points, and we asked perpetrator program facilitators and victim service facilitators to answer about this recidivism. And with this specific item, we get more different results. So the level of recidivism was quite different depending on the on the case manager that was doing the assessment. So we saw that facilitators of perpetrator program in general have a lower perception of recidivism if we compare it with the facilitators of victim services. So that shows how important it is to have this coordination between services, because then we can really compare the perceptions of both. So, for example, we can see that at time 2, we had 90% of recidivism perception coming from the facilitators of perpetrator programs, and from the victim services, it was nearly 48%. So there is a quite a huge difference here. And another important program outcome, safety, focusing on safety. So we've seen here that there is less need to call the police throughout the program, but also what's more important is that the perception of fear, or the level of fear that both say that the victim have, also decrease. So we ask the men, okay, what is the level of fear of your partner towards your behavior? And we ask the partner or ex-partner, how often do you feel afraid of him? And we've seen that this decrease, and this is also very important. You can see the graphic here, the men account at the beginning and the partner or ex-partner accounts at the end. So at the beginning, she was perceiving that she was more afraid than his perception, but then we see that both decrease significantly. And then according to the risks reported by the case manager, because this is the risk reported by the men and the partner or ex-partner, but the risks reported by the case managers, they also decrease significantly. Both the high risk perception, the intermediate risk perception, and also the risks on the children. So this is also very important. So now I'm not going to review all these graphics, but it's just for you to see the tendency that it's increasing. We, as I was saying at the beginning, we also assessed how useful has been the protocol from the perspective of the case managers. And we can see here that the protocol has been very useful for the case managers, from the case managers' perspective, specifically for fostering multi-agency cooperation, to increase the safety of victim, and also to reduce the risk of recidivism. So you can see here that at the beginning, so these are the different time points. So we assess this at 4 time points in all of the meetings. So you can see that at the very beginning, there are not everyone is entirely convinced that the protocol will be useful for multi-agency cooperation, for safety of victim, or for recidivism. But at the end, in the right hand, you can see the last time point in which we gathered the data that nearly all of the participants think that the protocol has been very useful for these three aspects. So it's really changing the perspective also of the case managers, and this is also very important for us. And as Elena was mentioned also, there is very high agreement, but this is also consistent from the very beginning until the end. So they were very convinced of that, the case managers at the very beginning of the program, and they are still convinced at the end that the protocol can respond or can help responding in a very practical way to new circumstances or crises. For example, as Elena was mentioned, any type of crisis at the moment was the COVID-19, but it can be any type of crisis that emerge, protecting children, and also on the digital violence. So it seems that fostering this cooperation and the items and risks that we have included that focus on these aspects really help case managers to give response in a very fast, let's say, and effective way to these new challenges that emerge. So moving to the last part of my presentation, the lessons learned and conclusions. Basically, there are four main aspects that I want to emphasize here. First, it's important to strengthen the cooperation between perpetrator programs and victim services, as it has been mentioned also throughout the previous presentations. The importance of adding an assessment of the risk for children, and I will explain in a moment also what I mean with that. The importance of adding this action plan, and I will explain a little bit more about this. Elena has briefly mentioned this, so I will mention some of the results we obtained here, and also the final usefulness of the protocol. So we've seen that it's very important to increase this cooperation because it's really important to get the feedback of the partner or ex-partner on the change of the behavior, but also on the change of the impact. We've seen that this is really relevant because without the information from the partner or ex-partner, we wouldn't know that at the very beginning, the men in the program seem to be less realistic about their behavior and about the impact of their behavior, but then this is also changing throughout the program. So having the partner accounts really help us counterbalance, let's say, the accounts of the men in the program. It's very important also to have the feedback of both workers. We've seen that there is a bit of difference in the perception of recidivism. So this really emphasized the need to collaborate when assessing all these items, but especially the risk of recidivism. And also it's very important, this joint risk assessment procedure, because it really showed that the risk is decreasing, and also according to both case managers. So I think this is also a very interesting result. So we also have seen that it's very important to add the assessment of risk for children. As you probably know, for a long time, children have been kind of the forgotten victims of domestic violence. So we know that they are also impacted by domestic violence, even when there is mainly IPV between the two parents. So there's also an impact of violence on children, and this is very important. We've seen that this is still a challenge to reduce the impact of this violence on children and to assess how this impact is reduced from the perspective of perpetrator programs. So we really recommend to continue this path and to assess this impact on children in more detail. Then, and this is connected to what I was mentioning about the children, in terms of action plans. So we also asked, as Elena mentioned, then, okay, according to this assessment that you have done to the case managers, what action plan do you propose? What next steps do you propose? And they could answer the next step. Mostly psychotherapy or following a perpetrator program or attending victim service, continuing attending the service for victims. It has been the main recommendation. Some recommendations that were less present than this one, but they were also quite present. It's to do joint safety plans or to increase coordination between services as an action plan, so as a next steps. But for example, improving parenting or increasing protection of children was less prominent in the proposed action plans. So we see how might be still forgotten for many professionals. So we really need to emphasize and focus on children. And then, as a final reflection, we've seen that the protocol is deemed very useful from the perspective of the case manager to increase multi-agency collaboration, increase victim safety, but also to respond to new challenges that are probably going to emerge in the next years. So this is everything from my side. Thank you very much for your for listening. And here you can see also our website. And if you have any other questions, we will now have a session on questions, but you can also write me in the email.
Thank you, Berta, for a really clear presentation. I think you demonstrated how thoroughly you paid attention to measuring the outcomes of what you are doing, and including perspectives of the perpetrator, of the victim, but also from professionals. As you mentioned, that's really important and usually not applied when we are making these innovations in the practice. And I think that the results that you showed eliminate any doubt if this kind of approach can work and if it can have benefits for victims, perpetrators, but also for professionals and simplify their work. So thank you both, Elena and Berta, for sharing your experiences in implementing ASAP 2.0 project. I invite all our participants to put any questions that you have in the chat, because this is now the opportunity to discuss with the presenters. And I would start with a question for you, Elena. So we know, and you mentioned that ASAP has been implemented in different countries, and that this is a project that started before and then upscaled. So what are your views on the implementation of this approach in different countries? So were there any specifics in different countries, any specific challenges in different countries, or also some common issues that you can see?
As you know, each country has a different, or each organization has a different type of perpetual program. So they differ greatly, both in the length and duration of the program. So, for example, we have the program from Naya is 6 months, and the one that we have at Una Casa per l'Uomo was 19 months. So it's really different in duration, and also in all the steps that are involved. We also see a great difference in the types of perpetrators that we have. In some countries, they are all court mandated. And in other countries and other situations, there are privately volunteers. So this poses great challenges and differences, because the differences are very high and huge. But we are lucky enough that the protocol is flexible and it can be adapted to the two different situations. So it can be easily used for a 6 month program and for a 1 year program. And this is really important. It's obviously some of the challenges are mainly deriving from the fact that we need to have both the perpetrator and the victim attending the program at the same time. So, for example, again, in Bulgaria, they have both the victim and the perpetrator at the same time in the programs. But in other countries, this is not always possible, because the woman may have attended the program before the man and so on. But again, we are flexible enough that we can manage all of these situations. And one of the good things, as I was mentioning, is that we can use the protocol both with external support services, but it can also be used within the perpetrator program through partner contact, so that we can always have the chance to get the information from the victim and share and compare the results of this. Sandra, we don't hear you.
Thank you, Elena. I think this is also encouraging, because it shows that actually the model is flexible enough that it can be implemented in different contexts. And that's something that for sure is important for our participants. Yeah. Berta, you were mentioning the risk assessment and how you also focused on monitoring the safety of survivors throughout the process. And we could see from Elena's presentation that you developed some risk assessment tools. However, in practice, we know that sometimes organizations use different tools like SARA or DARA, or that perpetrator programs and victim support service use different tools. Did you encounter these situations? And are there any ways that this can be integrated in joint work and protocols?
Yes, we really face this situation because obviously organizations already have their own practices. They were not starting from scratch. But the idea of the risk assessment, for example, now focusing on that, because this is what the organization usually have. They usually don't have a standardized procedure to assess outcomes, so implementing the impact is rather easier. But risk assessment, usually organizations, they already have their own risk assessment, or if we collaborate with police, they also already have their own risk assessment. But the risk assessment that we have in the ASAP protocol is quite, let's say, short and comprehensive at the same time. And many of the information that you can gather with other risk assessments, you can also build in or integrate it to our risk assessment. Then some of the items that might not be integrated in, for example, SARA or other risk assessment tools, you can then fill them afterwards. I don't know if this was clear what I mean. But we have some innovative aspects on cyber violence, as I was mentioning, and so on, that they are very specific from our protocol, but then there are other risks that might be that can be integrated from other risk assessment tools that organizations might have already implemented.
Thank you, Berta. I have one related question, either for you or for Elena, that also focuses on risk assessment. So, did you have cases in which you carried out a risk assessment for a perpetrator who is not longer with the victim but has a new partner? And what you do in these situations? Do you also consider the risk for the current partner, or what are your experiences about this? The participant is explaining that even if the victim hasn't filed a complaint against the perpetrator, she doesn't qualify as a victim, but we know that there might be some risks included.
I mean, the specific questions on the practicalities and how we implement it, they will be discussed in the roundtables afterwards by the partners who implemented it. What I really want to emphasize is that whenever we do evaluation or whenever we do risk assessment, if there are new partners, we always recommend to include also the new partners. So because we know that the violence can be also repeated with new partners. So we always have these specific recommendations. So that would be our recommendation, let's say. I don't know, Elena, if you want to add something about the specific. Sorry, you're muted.
We have cases exactly like this where we were actually working with the ex-partner, not with the current partner, but we try to include risks related to both and to keep in mind the situation for both, so that also the safety planning done by the support service was comprehensive and taking into account every possible risk for the new partner that was not directly involved in the process.
Yeah, absolutely. And I could add that this is also the practice that is recommended by the European standards for perpetrator programs, that we need to consider risks to new partners or any potential victims in the process. Okay, we received quite a few questions from the chat, and some of them are focused on the target group. So there is a question: is the protocol aimed at perpetrators who are only over the 18, or it can also work for younger perpetrators? And also, did you have experiences in including LGBTQI plus individuals in your programs, so both perpetrator programs and victim support services?
So starting from the last one, we in the implementation we didn't have any GBTIQ case, but I think that the protocol could be easily adapted because I would say it's quite flexible. The structure can be adapted to each and every different types of situation that we encounter. We just, I think, if it's very specific target groups, we just maybe specifics items, maybe in the risk assessment or recidivism or things to keep in mind. Also, in the programs that we currently have, we only have adult perpetrators, so we have not tested the protocol with minors or young perpetrators.
I wanted to add that we are fine-tuning some of the tools that are included in the protocol and adapting them, especially for working with young perpetrators or minors. So we are doing this in the context of another European project, I say that project. So please also stay tuned because some of the tools, specifically the impact toolkit and other tools, we will update them and adapt them also for this target group.
Yeah. Okay, good to know that there are some linked activities and linked projects. There was another question that also focuses on the cases when partners are not together anymore. So if they're separated, there's no children involved, and they don't want to restore their relationship. So the participant is asking if this cooperation then makes sense, by your opinion, and also for different sexual violence cases, for example, from the perspective of the victim. So what are your views on this?
I think that the collaboration still makes sense because it helps monitoring the risk, even if it's low. It helps, a regular monitoring of the risk and to prevent escalation. Maybe unforeseeable, but this really helps keep track of the situation. And so, yeah, I would use it anyways.
And if I can add, because when we say collaboration between the two services, the aim is not to restore the relationship. I think it was mentioned like this in the WhatsApp, no? So in the chat, sorry. The aim is not to restore the relationship. The aim is to ensure the safety of the victim and to ensure that the practice of the perpetrator programs are efficient and safe and that they are not increasing risks. So that's the main aim, even if they, still are still together or not. So yeah.
Yeah, this is important because I don't want, yeah, maybe people do not think that we are trying to mediate between the two parties. That's not the goal of the protocol. The goal is to monitor the risk, so to avoid escalation or recidivism and to increase the safety of the victim. Really, we do not want to do mediation or to bring them back together.
No, absolutely, and I think that this helped us to make this visible and clear. And I would also add that this is also in line with the European standards for perpetrator programs, that even if couples are separated and there are no children, there still needs to be partner contact and this kind of cooperation. Okay, I would like to thank you now. We have one more question that we haven't addressed specifically that focuses on how many sessions the program has and how much time it takes to complete it. I know it's different in different countries, so my suggestion is that we leave the answer to this question when we have the panel with representatives of different countries.
Yes.
So many thanks, Berta and Elena. It was indeed really interesting and inspiring. And thanks to all participants for being actively engaged and posing a lot of questions. This is our second session for today, and I'm very much looking forward to this session because it will show us how multi-agency work can be applied for different target groups and in different contexts. So we will be hearing about the multi-agency model in cases of violence against older women, so Marvo project experience, but also how the collaboration is established between the police and different services, and the experience of the change project and integrated territorial approach. I would like to invite all participants to put any questions that you have in the chat. We will make sure to address all your questions. And I would now invite our presenters, Silvia Maschio and Augustina Zacca. They're joining us from Italy. Silvia Maschio is coming from the organization Itaca Cooperativa, and she's the coordinator of the youth and community development in the area of Ithaca. And Augustina Zacca is from the Istrice Association, and she's psychologist and psychotherapist, but also perpetrator program worker at Istrice programs. And Silvia and Agustina will speak about preventing, identifying, and addressing gender-based violence and share the experience of change integrated territorial approach. Silvia and Agustina, welcome. It's a pleasure to have you, and the floor is yours.
Thank you, and good morning, everybody. So good morning, everybody. I'm Silvia Maschio. I work at Cooperativa Itaca, which is a cooperative based in the northeast of Italy, and is the lead partner of the project Change that I'll be presenting to you this morning. Before starting, I'd like to thank on behalf of Ithaca, the organizer, and all the technical staff for the invitation to be here this morning and the opportunity to talk about the project. Sorry. Okay, sorry. Change, Pathways to Prevent and Combat Gender-Based Violence, intervenes to support a multi-agency coordinated and effective response to fight and prevent gender-based violence and domestic violence in the Friuli, Venezia Giulia, and Veneto regions of Italy. The project is funded by the European Union under the SERV 2021 Daphne program. Change started on November 2022 and will end in November 2024. The project aims to achieve three main goals. The first is prevention and awareness rising about gender-based violence through dedicated educational activities in schools and awareness meetings for adults. The activities dedicated to students have a wide target from 6 to 18 years old students in order to both promote early intervention and address early risk factors that, if not identified, can over time generate violent behaviors. The second goal is to increase the knowledge and skills of professionals through training. Here, the interesting aspect is that the project has two types of training. One, the in-depth training dedicated to service desk professionals. The other one for a variety of targets who may not find themselves in need to work directly with perpetrators, but could be, with appropriate tools, able to intercept critical situation and support male perpetrators by giving information about dedicated services and facilitating men's access to programs. These professionals are very different. We targeted social assistants, but also psychologists, professional educators, doctors, nurses, physiotherapists, and also lawyers and law enforcement officers. The third goal of the project is to promote the actual opening of service desks and implement programs dedicated to men perpetrators of violence. With respect to the awareness paths in school, Change has already carried out or formally schedules activities in 135 classes. As you can see, most of the workshops are being dedicated to first grade schools, which means from 11 to 13 years old students, but also elementary school and secondary schools have been reached. The project promotes different approaches and tools to work with students of different ages. In particular, elementary schools and first grade secondary schools, which are based mainly in Veneto region, are working through educational workshops on gender-based violence prevention that have been developed also through a pre-existing project by Cooperativa Itaca called Alice Incontra Pollicino, into an approach that addresses gender-based violence prevention together with emotion management in elementary schools and affectivity and sexuality in first grade school. Secondary schools, which are based mainly in the Friuli Venezia Giulia region, are working on gender-based bias through the board game Free to Choose, which was developed thanks to a previous European project as a tool to help students acquire awareness of how gender bias can influence our life and professional choices. We anticipate that prevention activities will reach about 2,600 students across the two regions. Together with the activity with students, we are also working with the teachers on adult training about the same topics. As I said before, the project has carried out two different types of training. The first, based on the Engage roadmap for frontline professionals interacting with male perpetrators of domestic violence and abuse, was the one dedicated to a high number of different professionals who may not be working directly with perpetrators, but should be aware of the phenomenon, the existing programs and resources, in order to build and provide a multi-agency response and referrals to male perpetrators. 60 editions of this training have been already completed, led by the partner CAM as trainers, with a total of 295 participants. The second was the in-depth training dedicated to operators who already work and have basic skills in the field of gender-based violence and domestic violence, and was aimed to deepen the knowledge and skills on violence in emotional relationships and on how to structure and manage services for perpetrators. 23 operators have been trained in depth. Change has also activated 2 service desks per region. In Friuli Venezia Giulia, based in the cities of Pordenone and Gorizia, in Veneto, in the cities of Conegliano and Treviso. The service desks are managed by 3 partners, Una Casa per l'Uomo, Listrice, and Itaca. All the desks have been activated between January and June 2023. And as Agustina will show you in detail in the second part of this intervention, all service desks have had good results in terms of men reached and activated interventions. Everything I have been telling you so far has been reached through the collaboration of a large and diverse partnership. Change has 2 types of partners. First, the institutional ones that are stakeholders who have validated the project and will benefit indirectly from it. Their involvement is on the governance level. As you can see, they are mostly public health companies and 1 municipality. It is important to underline that even if the institutional partnership equals a less active participation in actions and no budget from the project, all of these partners have contributed actively and significantly to the project, especially through participation in meetings to identify strategies for networking, promoting training opportunities, building preconditions for the project to have an impact on the local policies in the future. The second type of partners are the operational ones. As you can see, they are mostly third sector organizations and mainly based in the same territories in which the project is working, which has been one of the strengths of the project so far, since the local network have been the key in reaching most of the project outputs a year before its conclusion. The project also benefits through WWP and Relieve of the support and knowledge of networks dedicated to the phenomenon, both at the national and European level. But formal partners are not the only network that supports change. The project has been managed according to the principle of community development in order to increase the chances to impact on the phenomenon and on the culture in general. The project, but more in general, gender-based violence prevention, has a lot of important targets beside the perpetrators, who are fundamental in order to achieve the goals related to prevention and cultural change. If the project operational partners had tried to accomplish the goals only through the work, this would probably have been the result so far. But by involving in the project stakeholder as the schools, the public health companies and their service managers, and also municipalities, both as policymakers and as managers of the social services, just a note, we've been so far working with about 30 municipalities beside the two that are in the formal partnership with the project. We can safely say that working with all the actors in the territory who share part of the goals of the project may represent the main strength in achieving the hoped impact and the cultural changes we all wish for. I will now give the floor to Agustina, who will present in detail the goals, methodology, and results of the activation of programs for perpetrators through the project. Thank you.
Thank you, Silvia. Now I share my slides. Okay. Can you see the slides?
Yes.
Okay, thank you. Hi, everyone. I'm Agustina Zacca. I'm a psychologist, psychotherapist, working with l'Istrice, that is an Italian association working with the perpetrator of intimate-based violence in Italy, in the region of Friuli Venezia Giulia, since 2016. I also thank you for the opportunity given to us to talk about the important work we are doing within Change Project. As Silvia mentioned before, the Change Project encompasses various actions aimed at raising awareness, training to frontline professionals and to perpetrator programs operators, and finally establishing service desks for perpetrator, which is the focus of my intervention today. These actions are closely interconnected, and we believe that the success of the activation of new perpetrator program is linked to prevention activities and to training for social and health professionals and law enforcement, who play a crucial role in identifying perpetrators and can often be crucial for encouraging men to seek help and to join a perpetrator program. Before discussing the activation of the service desk within Change, I'd like to provide a brief overview of the regulatory framework on gender-based violence in Italy. The perpetrator programs are based on the Istanbul Convention, ratified by Italy in 2013. Additionally, we have national legislation and regional regulation promoting prevention, victim protection, perpetrator accountability, and public awareness, among other goals. In 2019, Law 69, known as the Red Code, significantly impacted the work with perpetrator by introducing measures for victim protection and mandating domestic violence perpetrator to attend specific programs to benefit suspended sentence. Subsequently, in 2022, the state regions agreement established requirements for perpetrator program, including multidisciplinary teams, program duration, and objectives such as promoting awareness, accountability, and nonviolent behaviors. Italy's first perpetrator program for men was launched in Florence in 2009 by the CAM Association, with subsequent initiatives emerging. Then the Relive Association, established in 2014, united several centuries working with men perpetrators of intimate partner violence and contributed to developing national standards for perpetrator program. The first national analysis, conducted in 2017, identified the presence of 54 centuries working with perpetrators with 69 service desks. By the end of 2022, the number of centuries has increased to 94 with 141 service desks. So it is clear that in the last years, the perpetrator programs have almost doubled in Italy, with a predominant presence in the northern area. Within Change Project, our goals included making perpetrator programs more accessible for beneficiaries. In fact, we observed that distance in some cases was a barrier to engage in man during the intake phase. And specifically, our purpose was to provide assistance to an average of 15 male perpetrators for task, totaling 60 cases overall. Then we aimed to enhance interactions between service desks and local public institutions, such as social and health services and law enforcement, to strengthen the support network between institutions. And finally, we aimed to expand the training and awareness activities on gender-based violence, both for perpetrators and for the general population. The key activities of the service desks are, above all, to offer assistance to male perpetrators of gender-based violence, who can access voluntary or be referred by local public services. The majority are referred. Then we have planned to evaluate the effectiveness of programs by using the impact toolkit. Moreover, it was important for us also to establish interinstitutional working group to integrate and consolidate perpetrator program into regional prevention and anti-violence programs, also in consideration of the future sustainability of the action implemented within the change project. Let's
Agustina,
review.
just kind reminder that there's one more minute left for the presentation,
Okay.
just to be aware of that.
Okay, thank you. Okay. So I try to present you what the work we have done. So we opened, as said before, two service desks in Friuli Venezia Giulia, in Pordenone, and in Gorizia. They shared the same perpetrator program with intake phase that was focused on risk assessment with a motivational approach and with the evaluation of eligibility of perpetrators to the programs. And then they offered two types of group intervention, the informative group and the psychoeducational group. And also the partner contact is part of the perpetrator program. In Veneto, we set up a service desk in Treviso and in Conegliano, both by Cambiamento Maschile. The perpetrator program is similar to those used in Friuli Venezia Giulia, but the difference is in the length of the group intervention and the follow-up. Just to say that even the differences, Istrice and Cambiamento Maschile are both members of the national network Relive, so we share the same aim, so to first of all increase safety and well-being of women and children and to prevent recidivism. Just to say where we are in this point of the project. So one important result is the fact that we exceeded the target number of 60 perpetrators to be engaged overall. In fact, we totally reached 95 men. The chart shows the distinction for each service desk. So we can see that totally in Friuli Venezia Giulia, we reached 41 men and activated 27 interventions, while in Veneto, men reached were 54 with 30 intervention activated. So I conclude by just saying that the most important result of this project is the implementation of 4 service desks, because this is increasing the support provision in line with Istanbul Convention, and is also addressing territorial need, especially after the Red Code, which has led to an increase in the request of to join a perpetrator program for men. Another case is the complementary with other interventions that promotes a holistic approach to prevention, and additionally the interinstitutional collaboration. However, sustaining these initiatives over time remains a challenge for us, and also training focused on culturally sensitive approaches to perpetrators from migrant groups is also necessary for better engagement of this target group. And this is what we are observing within the work with perpetrators in the service desks. So I thank you for your attention.
Thank you, Agustina, and thank you, Silvia. It's really good to see that programs in Italy are developing as you described, and that you managed to establish this wide partnership. If you have any questions for Silvia or Agustina, please make sure to put them in the chat. And now I would invite our next presenter, Charles Hector Pagan. He's joining us from Estonia, from the University of Tartu, and he's analyst in the Center for Applied Social Science in Skite Institute of Political Studies. He has led multiple projects related to domestic violence, including the ongoing Tactic project that he's going to present now. And the project focuses on establishing cooperation between police and services. Welcome, Hector, and the floor is yours.
So hi everyone. I'm the principal investigator for the Tactics project, which is a SERV-funded project, and essentially is focused on bringing police into multi-agency cooperative situations. I think if I think about the connection between the ASAP from the previous discussions, our project, whereas ASAP, a lot of ASAP, it seems, is focused on developing tools that could be implemented to improve responses to domestic violence. Our project is looking sort of at the institutional relationships that would enable a better implementation of those types of tools. And so essentially our project was designed with one central idea, involved at the core, which is that multi-agency efforts are absolutely needed for responding to domestic violence. But one of the most important actors in these responses, the police, often are not as represented as they should be. I can speak from my own experience working with multiple serve and related projects. It's often quite difficult to bring police departments in to the consortia and to participate in the projects. There are various reasons for that. One of the biggest being that although the goals and priorities and methods of the police may overlap with support service organizations and also with perpetrator programs, they are not identical, and oftentimes they can be adversarial or contradictory even in terms of their goals. So the goal of the Tactics Project is to essentially try to bridge the gap between these institutions and do so by enacting structural changes. It's important to understand that from our perspective, structural change starts small and grows larger. So structural change can be simply an individual police precinct in implementing protocols that they would then follow, all the way up to changes in regional or national policy to better direct the police, let's say, participating in these efforts. It's also important to understand that structural change, significant structural change is a long-term process, but it's important to identify the short and intermediate steps that can be taken to try to achieve these long-term goals in doing so. So our partnership involves our full partners involve 2 universities and 6 domestic violence organizations and 1 perpetrator organization. And we have 4 local police departments who are associate partners, 1 from Romania, 2 from Spain, 1 from Germany. Again, this is partly, I think, reflecting the difficulties sometimes involving police as full partners in these projects for various reasons. But we were very pleased that we've been able to bring them in as associate partners on the project. So the main aims and activities of Tactics is essentially to improve response and follow-up of victims and perpetrators of domestic violence in the 7 EU countries, or in the regions in the 7 EU countries that are our partners: Belgium, Estonia, France, Germany, Greece, Romania, and Spain. And we are seeking to do that by increasing collaboration between the 3 sort of central pillars, let's say, of DV responses: the police and criminal justice organizations, victim support agencies, and perpetrator services. We're doing that by trying to identify individual, organizational, and system-wide barriers that hinders effective coordination. And what I mean by that is that the barriers can be all the way from the individual, frontline bureaucrat, the police officer that himself or herself, who's practicing, engaging in, let's say, practices that are not beneficial to responding to DV, up to organization or system-wide barriers. We're also looking to address specific special needs groups that we have found presents complications and additional difficulties when responding to domestic violence, whether it's police responses or anyone working in the field, in particular groups like the elderly, substance users, migrant populations, the disabled. All these different groups present additional challenges that can complicate matters. And then one other additional activity of our project or focus is exploring the ways that digital tools could be used to improve responses to domestic violence, both in terms of communication between police and service providers, but also in terms of assessing risk and also potentially enabling cross-country comparisons, which is somewhat lacking in the field. Um, uh, uh, the reality is that, like with many other types of public service responses, there are large amounts of data that's being generated. Every time we implement the tools that were described previously, as proposed by ASAP, for example, that's data that's being generated that could, in particular circumstances, be used, could be digitized and combined with new techniques and new technologies to be able to assess risk or to otherwise address the issue. So our project started in April of last year, so we're still relatively early in the process. And our first step was essentially focused on mapping the 7 regions in the 7 countries. This was very important for us because the consortium is quite diverse, involving small cities, larger cities, countries of complete different sizes. So we wanted to get a sort of an overview. We knew we would not be able to get let's say, a complete synthesis because the different regions would have lots of unique characteristics, but we were hoping to identify some areas of common understanding. And so as part of that process, desktop research was conducted, but also our partners conducted interviews with 180 people, mostly professionals, across the countries, either one-on-one or in group settings. And again, the groups were sort of separated between these 3 groups that I kind of have identified before. Victim support service providers, perpetrator programs, and then members of police and criminal justice entities. So we've finished this mapping process, and I would just talk a little bit about some of the findings from this. For those of you working in the field long-term in Europe, some of this will be quite, I think, spot on to what you've already experienced. So what we found is that most police units do now, at least in our regions, in the ones that we targeted, already have protocols in place for handling DV cases, but officers often don't use them, and it's unclear how they actually are enforced within the precincts. So, for example, victim support groups in all of our member countries reported that they have multiple instances where these types of protocols were violated, such as victims and perpetrators being interviewed at the same time when police are making house calls to respond to domestic violence issues. So, as just one very obvious example that anyone working in the field would know is a no-no. Also, we found that domestic violence training for police staff varies quite widely. However, most knowledge is gained on the job, quote unquote, not via specialized training. And there's a gap there amongst the police. There are lots of reasons for that. That I will go into a little bit later on. Many of our partner regions do currently use specific tools for risk assessment for DV. So was very nice to see that the police departments are increasingly making use of these tools that are being developed. One gap that we found, though, is that satisfaction and quality of services is not tracked in any of the partner regions. So it is unclear how, let's say, satisfied victims are with the police responses. That's client quote unquote satisfaction of police is a bit complicated, although it's applied in many other realms of public service delivery. Obviously, the role of the police is different, but it's still, I think, a key way of understanding whether or not the police is making taking the steps needed in order to effectively address the issue. In terms of the current levels of multi-agency coordination in our partner regions, we have found that coordination tends to be very ad hoc and varies between police stations. So, a service provider, a support service provider, might have a very good relationship with one prefecture or one precinct, and have a very poor working relationship with another one. And that's often depends on who's in charge in the precincts. It depends on what types of engagement has occurred previously. Or organizational culture also is relevant, but of course it differs between precincts sometimes. This is especially true when it comes to in terms of referrals. Some of our partners have very close relationships with the precincts, where the precincts actually make referrals of victims to the support services. In other cases, the victims have to find their own way to the support agencies. Most indicated that they do not have regular exchange meetings to discuss cases with the police. And in some cases, the police have look upon these types of meetings as for lack of a better phrase, a waste of their time. Cooperation seems to occur more often in less densely populated regions, something that maybe is somewhat of a logical conclusion, that there are less cases to deal with, so the police can put more effort into individual cases. Most reported that police stations do have specialized units for domestic violence or gender-based violence, or they have at least one or more social workers working within the precinct, which is nice. This is a relatively new change for some of our partners countries, as the policies have recently been implemented. However, a general finding across the interviewees was that police officers stated that they do not have the resources to deal with problems linked to domestic violence. And for this, the social workers are needed, and they're not basically getting that enough. To put it another way, in some areas, we're relying on the police to take on too many different roles that fall outside the scope of what they're really supposed to be doing. And then police also indicated that perpetrator intervention programs are often not known by police officers, especially when working domestic violence cases. So it's not something that they even consider, as an option in intervening. So, for example, if you have a situation where the officer decides not to make an arrest on site, they could still theoretically make a referral to a perpetrator program. It might have an effect in some cases, but they can't do that if they're not aware of those options. And then in terms of multi-agency coordination, some of the barriers and drivers, additional barriers and drivers that we found, is really centered on the idea of data. The police's ability to share data on victims and perpetrators with other professionals varies quite widely in our countries. Estonia, for example, from where I'm from, has a higher level of sharing, including digital sharing of some data, which can help protect victims, while our partners in France have indicated that it's a major challenge to share any types of data because of data protection laws. So finding ways around that is something that we should consider, especially if we're going to make use of advanced technologies, as I talked about before, and trying to implement digitized versions of risk assessment, for example. In the
Hector,
majority of
just a reminder that there's 1 minute left, so that
Okay.
we're aware of the time.
Yep, thank you. So I'll just skip along and then say some indicated that risk assessment of cases is limited to information only provided by victims. So contact with perpetrators isn't considered enough, and police are often unwilling to disclose or share their methods and practices. So, for example, DV and risk assessment protocols for police in some countries are not disclosed, nor is the precise content of police academy training. So if we want to change how training it takes place, it's hard to do if we don't actually know what the content of the training is. So just very briefly, over the next 2 years, Tactics will be developing a range of training materials to try to improve or let's say address barriers on the individual level. And you see there, those are the various topics that we have identified in our interviews as being gaps, at least as far as in the countries who we could get access to their existing training materials that's needed. And then finally, the last thing I said talk about is this just that our multi-agency solution to this multi-agency problem. What will be doing this year is finalizing the formation of multi-agency working groups in each of the target regions. And these working groups will consist of frontline staff and higher level staff from all three groups that I've talked about before, victim support services, criminal justice, and perpetrator services. And first, what we will do is have meetings, intra-meetings, where the individuals from within each group meet together to discuss their gaps and barriers and possible benefits they could take advantage. Then we will move on to meetings between professional groups. These are all going to be frontline staff. Shelter workers and police officers who are responding to domestic violence calls. And then finally, we'll end with meetings of higher level staff who are basically the decision makers for these different agencies, who will hopefully be able to start the process of trying to implement some of the changes that are needed. And the ultimate result of this will be roadmaps for each of the 7 regions that we've targeted that will address these various things that I've talked about multi-agency collaboration, formalization of cooperation between the police and other agencies, and also methods to improve risk assessment. So I think that's it. So I
Thank
hope
you very
I
much, Hector.
wasn't too over time, but thanks so
No,
much.
it was fine, and thank you for this insight into the situation of police and the gaps, the challenges that they're facing it, but also how this reflects on collaboration with other services. I think it's really valuable that now you have the research and the situation mapped, and we're looking forward to hear how these gaps are addressed as the project continues. Thank you, Hector. If there are any questions for Hector, please make sure to put them in the chat. And I now have a pleasure to invite our next speakers. They're joining us from Austria. So these are Alicia Sviton and Alia Luf, coming from the organization EOF, which is Association of Autonomous Women's Shelters. And they will share with us Marvo experience that focuses on multi-agency responses to violence against older women in cases of domestic violence. Alicia is a co-director of EOF, and she's a project coordinator of Marvo 2.0, and she's an expert in the field of gender-based violence and violence against women. And Alia is a specialist in legal affairs and child protection in EOF, and also the project team member of Marvo 2.0. Welcome, and the floor is yours.
Hello, thank you, Sandra. My name is Alicia Schwiton, and today, together with my colleague Alia Luf, we will be presenting the experience of Marvo and Marvo 2. And
hello, hi to everybody. We are very glad to be invited and to share our knowledge about the Marvo experience today.
Great. Thank you. So starting from the top, Marvo stands for the Multi-Agency Response to Violence Against Older Women project that started in 2019 and was coordinated by the Austrian Autonomous Women's Shelters Work, AOF. It's an association that is based in Austria. And I will just say a few words about the organization, and then we will go into the MARVO project and MARVO 2 project. What are the projects? Then Alia will talk about the objectives of the MARVO project and about violence against older women in general, why it's important issue in the topic of multi-agency collaboration. And then I will share a little bit more in detail what is the MARVO model and what are the next steps in our collaboration. Yeah, so here you have a small map of Austria, and you saw that we are organization of 16 women's shelters, and we are already existing since 1988, so we have more than 36 years of experience in working in the victim protection and yeah, generally violence protection through the women's shelters. But on the next slide, you will also see other parts of our organization. So we have the Information Center Against Violence, in frame of which we do awareness work, and in frame of which we also organize and lead and also participate in EU projects. However, our organization is also leading the Women's Helpline Against Violence, which is the helpline that operates based on the Istanbul Convention standards, and also help chat, probably one of the first help chats in Europe that's already working very long and since 2000 also in a very extended way and provides the online counseling. Very interesting is also the STOP project that we have also in Austria since 2019. It's a project that was invented in Germany by Professor Sabine Sturesand. And 5 years ago, we brought it into Austria, and it became a very successful, very interesting, very successful prevention project that focuses on the neighborhoods. And meanwhile, we have it in the 30 different locations in Austria. And since 2 years, we also lead the Bhakti Center for Empowerment for Girls. And externally, it has a program for Bhakti boys, for young boys that also are affected by violence, but also not necessarily. Next slide. And here I would like to also mention two of our previous projects that we were participating in. It's the Huseva, working with healthcare organizations to support elderly female victims of abuse. And you will see that since 2017, there was a continuous work on the topic of older women with partnership across Europe in order to, in different areas, also work on this topic and improve the awareness of the issue of violence against older women that Alia will be explaining in detail. Next. Cool. Then we start with MARVO. That was a project that started in 2019 and lasted until 2022. With 6 organizations in Europe. AWEF was the coordinator, but we have also Greece and Estonia, also University Tartu, and Hector, who was just presenting, was also part of the consortium, and 2 networks, WWPEN and also WAVE Network, were part of the consortium. In that project, it was very important for us to develop and implement a comprehensive multi-agency working model. So that was the goal, to create the model, to work on different theoretical approaches, and then to implement it. And we were implementing this model, the MARVO model, in the 3 countries, so Austria, Greece, Estonia, not nationally, but regionally in specific regions. And also very interesting, and it's also very interesting for multi-agency collaboration. And those who are listening, you can also think of your country and your local situation of your organization. There are different levels of collaboration, and the working assumption is that collaboration always exists. But sometimes it's on a very informal level, because we know somebody in another agency and maybe we call them, and that's the collaboration. Then there are more formal collaborations, and then there could be also coordinated collaboration. So for our learning also from MARVO 1, where we had 3 different countries with very different non-existing formal collaborations, so very informal, but also formalized, but not effective, and formalized, more effective collaborations. We have learned, okay, we need really very good documents and information for case management and structure for multi-agency collaboration. Next slide. So after this very long and great project Marvel 1, we have started with the second project that was even bigger. And now we are working with 10 different partner organizations in 7 countries. It's a partnership of 3 years. And we focus on another part. So we have the basis of how such multi-agency collaboration should look like, with the specificity of violence against older women. And we, within the Marvel 1, we have discovered multiple gaps within the system that we are trying now to close within Marvel 2. One of them is the case management. The second part is the risk management. So the question is, do we even receive any cases of violence against older women in the multi-agency collaboration if we do not ask the right questions in order to assess cases of violence against older women as high risk? And another topic that Alia will mention is the prevention of femicide against older women within the aging society. It will be also a big problem in the future. And very important, and always was a problematic topic, is working with perpetrators in cases of violence against older women, and specifically older perpetrators. So we know that the perpetration for cases of violence against older women are simply different than for other age groups. We have very often perpetrators who are in the dependency situation with the victim, or the victim is dependent on the perpetrator. There is care issue that is very often the caregiver, extended family, friends, or the professional caregiver. There is violence in institutional setting. There are different topics that will come in shortly. We implement the project in 7 countries. In Austria, Bulgaria, Cyprus, France, Greece, Italy, and Spain. The map is not the map of Europe. That was some formatting issue. And we have on board 3 European networks. The Age from Europe, which focuses on work with older women, older people, not gender specific, with older people. We have the European Network for the work with perpetrators of domestic violence, our amazing host today. And Women Against Violence Europe, WAVE Network, is our associate partner. And I give now the floor to Alia.
Thank you. So if we are talking about the objectives of Marvo 2.0, we are creating a risk assessment development tool and structured case management methodologies and tools for coordinated multi-agency work in cases of violence against older women. The organization of a comprehensive capacity building training. Then we will introduce, test, and mainstream coordinated multi-agency work protocol and create a legal framework, improvement proposals, and policy recommendations. Dissemination and promotion at national and EU level and beyond. The Marvo 2.0 activities on the subject, as Alicia already told, are case management, risk assessment, prevention of femicide, perpetrator work, and work with older offenders. Last autumn, we did in all our partner countries roundtables and EU-wide survey. The roundtables, we had 21 roundtables and more than 300 participants. And with the results of the roundtables and the survey, we did case management working group for the case management tool and the risk assessment development tool, even in a working group, to create an upgrade of a risk assessment methodology. This we are doing right now. And we are working on a training manual and trainings. The trainings will start this autumn till spring 25. After this, we will test the test of a work protocol. We will take part of case conferences and steering groups, and establish of coordinated units is one of our goals. This work protocol will be disseminated and promoted of the project in the nationally and international level, and we will do lobbying and advocacy. Violence against older women. If we talk about violence against older women, we always have to see the intersectional aspect of violence against older women. They are affected by violence because they are women, because they are old, maybe because of a disability, other forms of discrimination. We always have to see it in this way. The prevalence of violence against older women, the extent and frequency is very high. According to a study of the Agency for Fundamental Rights, 5% of women over 15 in the EU reported physical and/or sexual violence. 3 of these women reported having experienced domestic violence by their partner. A more detailed investigation revealed that 19 of women over 60 have been affected by intimate partner violence, but only 14 of women reported severe violence to the police. Therefore, the number of unreported cases is estimated to be much higher, even higher now in the time of many crises. There are 3 levels of violence. Cultural violence is about existing values and negative prejudices in a society. There is direct or personal violence. There's a direct relationship between the perpetrator and the victims. The perpetrator is known. And there is indirect or structural violence. This is constant violence without a direct perpetrator. If you talk of this kind of violence, it's institutional violence. It can be in a political context because of the patriarchy. It can be because of the institutional practice, or it can be any abuse that can happen in the institution. Austria is known as a country of a high number of femicides. Particularly striking and worrying is the rising number of femicides among women over 16 and older women. Here on the slide, you can see some examples. I just want to figure out maybe 2022. There we had to register 29 femicides, and 10 from 29 were over 60 years, 33%. You can see it's a very high number and it's increasing. We even have to talk about so-called extended suicides, which are also femicides. It's a murder of a woman because of her gender, even she is old. Femicides against older women are not nursing homicides. These murders are also showing toxic male behavior because older men assume the right to take their partner to her death instead of seeking help. Reverse situations, however, almost never happen.
Alia, just to bring your attention that the time is up, so maybe if you can wrap up in 1 minute.
Oh, yes, the time is up. Okay. Maybe then I should give back the floor to Alicia because she wants to say important thing about multi-institutional Alicia, are you fine with that?
Yes, that's perfect. Thank you. Sandra will take 2 minutes just to wrap up because we had less than 20 and yeah. So coming back, I think you got from the short intro from Alia how important it is that we look at the specific topic of violence against older women. And this is shown in next slide and next slide. In the Marvo model, the previous slide.
Sorry.
Yes, thank you. And the Marvo model focuses on two specific multi-agency meetings, the case counseling meeting based on the MARC model and system-wide meetings based on the CCR model. You also saw in the presentation of Hector with tactics the similarity where we would at one hand look at the multi-agency risk assessment conference here in this part. In this meeting, we meet in order to discuss specific cases. However, it's also very important that the safety of the victim. We do not talk about the risk assessment of so high risk of a victim, but we do talk about high risk situations, and we need to always reassess the risk. So it means risk is not a static situation, it's dynamic, and the monitoring, as you were also talking about all the protocols that there are in ASAP, we need to monitor the risk and bring it always to the situation where we know, okay, the risk assessment has to be repeated. Next slide and next slide. That's all right. I already said that. Good. The second part, the second part of it will be to work on the community response. So we not only work with the professionals that are working on the cases, but we also work on the full system. System-wide response is a response that brings together not only the first line, but also all the decision makers together. And whenever we see any gaps on the first level response, when we deal with cases of violence against older women, we constantly discover gaps in the system. So especially with our Marvo one, where we were testing the level, we noticed constantly there would be a gap, and we need to bring it to the coordinated system-wide response. We need to discuss what needs advocacy, what decisions can be taken within the organization itself in order to improve the response. So these two parts are very important. And next slide. And therefore, within the Marvo 2, we will focus on the further work. So it will be the risk assessment against case management, the survivor-centered perpetrator work, prevention of femicide against of older women, but also the advocacy. This is a very important part of probably all of our projects, that the work is not recognized by itself. We really need to discuss the topic not only of multi-agency response that is very important for all cases of violence against older women, but also to increase the awareness of the issue of violence against older women and ageism in general, because we are an aging society, and we also need to think how we will be living in the future, and that we also prepare a system for the situation that we will have in 20, 30, 50 years. And next one, if you are interested, please contact us. We have a lot of materials that will be very interesting also for the implementation, if you are interested to improve or learn more about these issues. There is a lot online. And the last slide is just a thank you from us for the invitation, and that we could hear from you and also to present Marvo.
Thank you so much, Alicia and Alia. This is such an important topic. And when I was hearing your presentation, I was again reflecting how often the violence against older women stays in the background. So thanks a lot for shining the light on this important phenomenon and preparing practices and tools that we can all use. If you have any questions for Alicia or Alia, please put them in the chat, and also to all other presenters in this session. I would now like to invite all the presenters to join us on the stage, and we will now have some time to discuss questions from the audience. I'm sure that there are many. It was really obvious that all of you had so much more to say because projects are so comprehensive and extensive, and it feels like we need more time to focus on each specific aspect. I would maybe first address Silvia and Agustina. It was really impressive to see the maps that you presented and how many partners and public services you managed to include in your cooperation. So we saw health companies, we saw municipalities, social services. So how did you manage to motivate public institutions to engage? And do you have any things that you would recommend?
Well, the answer to this question could require a whole other intervention, but fundamentally, the principle was to activate in the local communities the people that all the partners already knew that could have an interest. So the base for that network was sharing the goals of the project, not only as a presentation to the community, like a communication action inside the project, but really meeting people and evaluating together all the different organizations and stakeholders, with all of them, which of the project objectives were shared. So it's like a work on the matrix between stakeholders and goals in order to motivate them to be inside the project, not only because there was or there could be a formal partnership, but mostly because the stakeholders recognized in the project one part of their own goals and beliefs, and that helped us a lot. Of course, many of the relationships with the stakeholders that you saw in the slide were, work that the single organization, the partners had done before, because this kind of work takes a lot of time, which is why I underline the fact that having partners that have been working a lot of years in the same territories of the project was the strength. It is difficult to say what community development is. I don't know if you know it as a method, but it's sometimes it's funny when we are asked how we do things, how we work with people. The answer is often we go around, talk with people, and drink a lot of coffees with them.
Yes, it seems that a lot of things start with the relationships and past relationships, and as Alicia was mentioning, how then these informal relationships can grow into more systemic collaborations. And as Hector said, that this kind of systemic changes start small, but then they grow. Thanks a lot for sharing that. Hector, we have one question for you. So the results that you are presenting, do they reflect only Estonia or all implementing countries?
All the implementing countries. The interviews were conducted in all the different regions. So again, though, that in some cases they're targeting very specific locations in very large countries. So what might be reflected in one part of a country doesn't necessarily reflect what's happening in other parts of the country. So think of it more like a snapshot of the partner regions.
Yeah, and I think that definitely adds a value on the findings of the research, because it represents several countries and probably reflects the situation also in countries that are not included in the research. Thank you. And we received several questions for Marvo project. So a question for Laura. What tools have you developed to work with older women? And meanwhile, I also invite our colleagues to put in the chat anything that is publicly available.
So actually, within the Marvel project, we do not work directly with the victims. Only the organizations that work with us would work then directly on the cases of violence against older women. However, within the presentation, I think there was also one slide with the resources that can be used from Marvel One, but also from the projects Huseva and Tisova. There is also a very good manual and training program to identify violence against older women, specifically for healthcare, but also social workers. It's very interesting, and I will actually myself move a bit to the other questions that I see that it asks about the risk assessment, because that will be the interesting part, I think, from our perspective, is that the risk factors are different for older women than for younger women. So the ideal victim somehow that is a younger woman would be a person who recently probably separated from a partner, has kids maybe. That's the victim that enters, for example, a women's shelter. Now, the older woman would, that's not the case for older women. She might have children, but the children might also be perpetrators. She has probably a dependency issue. So there might be a recent or not recent disability that comes into place, a medication that she would take. There might be an issue of neglect, but not necessarily. It might be a care issue. So if the person it requires care, it would be already a risk within case. Alia, would you like to add that? And
No.
this, we are now finalizing the methodology for the risk development. In those cases, it will be also like, I think Beata was telling also that it's adjustable. So we know that in each country, and in our roundtables, it was also clear, each country and often each organization has their own risk assessment. And this is also very important to ask the right questions. So we cannot focus, oh, this is only one methodology that there is. However, we need to ask the right questions for the right person. And if we only ask about the ex-husband or about the kids, we will not, we need to also ask the right questions for an older woman.
Mm-hmm. There was another question that is connected, but I want to see if there's something that you would like to add. So there is a question: what are the significant differences in needs or approach to supporting older women that you have identified so far? So risk assessment is one of them, and you covered already a lot, but is there something that you would add?
Yes, this is the, I think what comes directly to my mind, something that actually we did find one very good best example in Austria for a specific case of that is an issue everywhere. Older women are often in the house with a perpetrator, but sometimes it's an older perpetrator and it's difficult to separate them. It's difficult to take the woman and take her to a woman's house. It's difficult to even remove the perpetrator, who's also an older man, because there are no possibilities. We found one example in Vienna. In the city of Vienna, there is a multi-agency collaboration on a more, I would say, knowledge level, which worked out a flowchart for different possibilities that there are in the city in order exactly for these older women, older victims, and older perpetrators, how they could deal and which organization can help, and in which cases what should happen. And this we just use, and it will be also, sorry, then presented in our materials, but probably in, we still have 2 years to go of the project, but probably we will share this also. That shows basically how well we can also collaborate. But it requires, of course, that there are possibilities. So that there must be some kind of housing, there must be some 24 hours care possibility.
Thank you. I really have a feeling that this is just a taster of this important project. So change tactics and Marvo, and there are so many important information and experiences and practices to share. And I invite all our participants to stay in touch with projects and our presenters and connect, because this is the opportunity that we can take in these kind of events. Thank you to all the presenters. It was really inspiring and useful, and also thank you for being mindful of the time. Describe the impact of your programs. So as mentioned, there are 4 areas in which I would like us to focus on. And I will pose a few questions, and I would really like to hear responses from all of you, because probably there are some similarities, but also some differences in different contexts and countries. It's also important to be mindful of the time. So yeah, please also make sure that we end the session on time. Okay, so we were speaking a lot about multi-agency work and coordinated community response, and we could hear in the introduction the overview of the ASA project and the needs and gaps that the project was focusing on. And we could also hear that, although we know that this is really important issue, that we usually face a lot of challenges in practice. So how to engage relevant actors so that they are willing to cooperate, how to address data protection concerns, how to work effectively together. So this is exactly what ASAP 2.0 was focused on. I would like you to share what were from your perspective key achievements and lessons learned in fostering collaboration with local authorities, but also with various service providers. And Laura, if it's okay, maybe we can start from you.
Okay, so the Italian context presents significant resistance in the collaboration between victim support services and perpetrator programs. Through the ASA project, we have carried out focus group involving both oppositional victim support services and victim support services theoretically favorable to collaboration. And first of all, it was interesting that victim support services with different position could confront each other in a space of discussion that is rarely opened. So a safe and open space is provided for sharing concern and resistance while respecting and accepting different point of view. The focus group conducted at the beginning of the project allowed the clarification of doubts and concern and an initial collection of willingness to collaborate in practice. Some victim support service greatly appreciate the fact that there were concrete guidelines that established exactly the information to be exchanged, and also that at every stage of the process, it was required to make explicit the woman's consent to the exchange of information without ever taking it for granted. As Naya, also we have both victim support services and perpetrator program, and we have been using the protocol since 2019. From the first to the second ASAP, for sure we noticed some important upgrade. First, at the end of the first ASA project, we conducted a focus group where the Victim Support Center involved requested the introduction of an additional document that was the MSA, which was implemented in the second project. Second, we have extended the number of Victim Support Center involved, and we're going from 2 to 5. And after the training, also we received the request from both Perpetrator Center and Victim Support Services to receive the protocol and further training, indicating a positive sign of openness. And so we have shown that collaboration is possible, that it can be done, that there are practical tools, and that is not just a goal to look at.
Mm-hmm. Yeah, and that there are mutual benefits, as I can hear also from your presentation. Thank you, Laura. Nicholas, how was this in Heraklion? So what were the lessons learned and key achievements?
Hello. I start from the last statement from Laura. The multi-agency is not a goal to reach out. It's a dynamic process, and we perceive it as a staged process. We have seen that professionals are somehow very positive on the perspective of multi-agency collaboration. However, we feel that it's a very much uncertainty of how the process would be. We emphasize that the introduction of multi-agency process is a learning process, is a mutual learning process that we learn from professionals from different disciplines. And we invest on that quite a lot. The last 2 years, we have invested quite a lot as organization, not only at our territory, but at regional level. And these, we see some positive steps. The ASAP protocol has boosted the process, and we consider it as a valuable asset to this process. And at the last meeting, for example, that we have had at national level, we have seen the very positive inclination, let's say, the positive attitude of professionals to get into the process. However, we need to support them on the implementation, on the use of the process, on the use of the tools. It's not like a one-off process. It's a continuous process for maximizing the use of the ASAP tools, for example. In Crete, we run the multidisciplinary, a small multidisciplinary group just recently. It's a very start, but it's a very good start, and it complies to our previous like advocacy and voice that we have had on promoting multi-agency. So all in all, ASAP has provided a very significant input to the process and the professionals. And again, multi-agency is not a goal; it's a process, and it's a dynamic process. And somehow, at some point of time, some properties of multi-agency might change according to the climate of the frontline agencies. Thank you.
Thank you, Nicholas. I wonder how things were in Bulgaria. Was it challenging? What are key achievements? And yeah, lessons learned that you would like to share?
So NAIA provides both programs for victims and for perpetrators. This is the usual practice in Bulgaria. There are some challenges with this closeness of victim support services and perpetrator program in same organization, such as informal communication between case managers, lack of clear meeting schedule, lack of documentation and follow-up. We integrated the SAP protocol and its tools into our internal procedures in 2019. This helped us to have structured cooperation, continuous exchange of information, common risk assessment, and common planning between the two programs. Through the protocol, we are able to follow the dynamics of the case better. We can implement more effective interventions, especially in high-risk cases and episodes of recidivism. In the first ASAP project, we implemented multi-agency cooperation in 3 cases. Through the second project, we were able to strengthen our partnership with the police and the Child Protection Department, and cooperation with them is a regular practice in all cases involving children and in high-risk cases. We also cooperate with the social department, municipalities, other social services, and village mayors. We work in a region that has nearly 200 small and difficult to reach villages. This partnership helps us to reach and support more victims of domestic violence. NAIA has been developing a unique practice for Bulgaria in partnership with Police Department for 10 years. Our program for perpetrators is provided together with the police in 3 municipalities.
Thank you, Amina. Thanks a lot for sharing. And it's also nice to hear that how things have developed, because you were explaining how it started and then how the number of partners that you had in your local community increased. Emily, what were the specifics around lessons learned in multi-agency cooperation, key achievements, but also challenges in Cyprus?
PAVO is the only organization in Cyprus that works with domestic violence, and it provides services to both victims and perpetrators. The Perpetrators Program in Cyprus was created in 2020, and emphasis is given on prevention and early intervention through education and promotion programs in the community. The goal was always to raise awareness and reduce the frequency of violent incidents. Throughout the years, having both programs existing but not directly collaborating seemed to be a challenge and not being enough. We needed to have efficient collaboration between us. So with the use of the ESAP 2.0 protocol implementation, it provided us with a structured collaboration, an action plan, and an established practice between victim support services, the perpetrators program, and the external agencies. Also, for SPAVO, the implementation of the ESA protocol enabled us to inform the agencies about the programs and encourage them to refer both the victim and the perpetrator to our programs through different focus groups that we carried out throughout the time. And some of the challenges we experienced refer to the insufficient communication between the agencies. We had some information gaps on the cases. There were some cooperation problems that seemed to arise due to different legal and administrative regulations. But we tried to overcome these challenges through the use of transparent and continuous communication between the services, always based on the importance of confidentiality and information privacy. And we always tend to promote open and continuous dialogue, cooperation mechanisms, ensuring that communication channels remain open to enhance this cooperation that we aim to achieve.
Thanks a lot, Emily. It seems that even through this short exchange, it's obvious that there are some similarities between different programs, but also some differences, and that the ASA protocol can be implemented in all these settings. So Laura was saying the cooperation in Italy between perpetrator programs and women's support services was really challenging. Both Emina and Emily were saying it's specific that our organization is providing both perpetrator program and support for victims, but still we were not so well connected with other agencies, and still we lacked internal procedures on how to work together. And Nicholas was also mentioning the lack of multi-agency work in the local community, and how this is also supported through ASAP 2.0. And if I can summarize some of the key elements for me, is that you all described that this cooperation requires patience, requires time. So you were saying that this is dynamic, but also collaborative process. And all of you explained how all actors were actively participating in the process. So it wasn't something that was just delivered to them, but you were listening to their worries, accommodating their concerns, requests, developing protocols, and even regarding the data protection, also provided clear protocols that make sure what kind of information is exchanged between whom and how. So this is a good step forward. The collaboration is dynamic, but we also know that domestic violence is dynamic phenomenon, and although that the root causes remain the same, the way that domestic violence is presented is changing. So we know that nowadays we have pandemic of digitally facilitated violence and online violence, and that you took this into consideration when you were implementing ASAP 2.0 in your communities. So, how did ASAP 2.0 practice and protocol contribute that you adjust your program and your practice to tackle online violence? And how have you balanced between advantages and disadvantages of working in an online setting, also taking into account risks that are related to this format of the work? And Emily, if it's okay, I would start with you. And what were the SPAVO's experiences in this process?
So for SPAVO and the perpetrators program, it was not common to conduct sessions online, but things changed after the pandemic of COVID-19 and the implementation of ASAP 2.0 protocol. So the program began to conduct the sessions online as often as possible. We aimed for once a week, as we wanted to minimize the risk and assure victim safety even from a distance. Through the online sessions, we're trying to provide the perpetrators with frequent updates on online violence and educate them about the different forms of violence in general. And also through the meetings, there was often communication regarding the psychological effect of online violence towards women, such as the development of depression, anxiety, maybe low self-confidence, and so on. As we noticed that many of the perpetrators needed to be educated, they had limited information on online violence. And has been noticed throughout the years in Cyprus that cases of online violence in general were not recognized from the public as a form of violence. However, the cases seem to be increased in the last year in Cyprus, and for that reason, SPAVO aimed through its programs to raise awareness for online violence through workshops and seminars. At the moment in the program, we only have a couple of cases that we contact online, as in Cyprus, because it's the only organization, we try to provide services to all perpetrators in all cities in person. But whether that's the case or whether we contact the sessions online, we still talk about online violence and its consequences on the victims.
Thank you, Emily. Nicholas, how are things in Heraklion regarding the online violence, but also online work?
Yuva has been much worked on combating cyber violence since 2019. Just recently, we have developed the first protocol for the frontline professionals on responding to incidents of cyber violence. But at the same time, we have been much working on with our beneficiaries, the women and the perpetrators at an online basis, even within the period of the pandemic. We have seen lots of issues arising. We have seen lots of demands from professionals for continuous training. Also, we see the need of much more capacity building on the properties of the phenomenon that rely upon the legal aspects and the technology issues. And we need to see that online violence is not a form of physical violence, but is a phenomenon that has implications on physical violence. So we see that we have seen a limited capacity of the professionals at local level on combating cyber violence, but at the same time, they had to deal with their beneficiaries at an online environment. So we have to feel, and we see the need to fill many gaps there, many uncertain aspects to the process, and it's we are happy that we somehow know better than yesterday, for example, the picture and the needs and the gaps. And it's good not to generalize, but to go on specifics and to try to build an upscaled narrative on how professionals would reach the best out of the case. Thank you.
Yeah, there's a lot of done, but still work in progress. Yeah. Thank you, Nicolas. Laura, how were things in Una Casa per l'Uomo regarding the aspect of online violence and online work?
Yes, so knowledge on the topic of that digital violence in Italy is still scarce, despite data indicating our country as ranks as the fourth in Europe for the presence of online violent behavior. An extremely significant initiative in these regards was the European project The Stalk, that we do with WWP and other partners that aimed at developing a capacity building strategy to counter cyber violence and stalkerware. And during the project, Una Casa per l'Uomo developed several toolkits, one for providers working with survivor, one for providers working with perpetrators, and a practical guide for the victim of online violence. Now we use it in everyday practice with women to detect possible instances of online violence and to draft safety plan. And for perpetrators, Una Casa per l'Uomo delivers a psycho-educational session on this topic. Regarding the ASAP 2.0 protocol, including cyber violence against women in the risk assessment and in recidivism assessment, I think that help keep the focus on these important aspects for all the process.
Thank you, Laura. It's also good to see how different projects and activities integrated in your practice. And Emine, in Bulgaria, what were your experiences?
In Naya, we have 20 cases of online violence in our practice. This is a new challenge. The victims share what even the perpetrator are outside their homes and have a restraining order. They continue harassing them on the phone and on social media, so the women still feel in danger and under control. They do not feel that they are separated from the perpetrator and that the violence has stopped. Very often, the stalking and harassment against women continues through online communication with children, monitoring their profiles, using photos and videos. Thus, the violence in reality continues in the virtual space and has the same negative impact on the victims' lives. We introduced online violence into the risk assessment through the updated version of the ASAP protocol, so we can address this aspect in our work and prepare an IT safety plan for the victims. We have developed internal procedures for online counseling of victims and perpetrators. We have internal policies to ensure safe communication channels, secure accounts, and secure devices. The good news is that after changes in the specialized law on protection from domestic violence in Bulgaria, online violence is now included in the protection measures, and we have a legal mechanism to limit it.
Yeah, these are also really encouraging developments in the legislation in Bulgaria. And thank you for presenting how you integrated this aspect in your work with perpetrators, but also in your work with victims. And we could hear a lot of good examples from all of you. But also, most of you also highlighted the need to increase our own capacities and capacities of different stakeholders. And this is also something that you did through the ASAP project, and you were mentioning different kinds of trainings and workshops and tools for yourself and for other professionals. And some of you also initiated the online work and developed procedures how to make sure that this is safe work. And as Nicola said, this is definitely still a work in progress for all of us, which is, I think it's really important to share all the experiences and materials that we have on the topic. Another topic that is usually neglected and in the background when we talk about domestic violence is the topic of children and child safeguarding and protection while we work both with perpetrators and with victims of violence. We could hear in the introductory presentation that this was integrated in ASA protocol together with online violence, and that these were upscales of the protocol. But now I would really like to hear from you and your practice. So how did you integrate the perspective of safeguarding children in your work? Lessons learned and good practices that could be useful for our participants. And Nicolas, if it's okay, I would start from you now.
Thank you very much. Thank you very much, Sandra. Actually, child protection issues were sometimes the cases for us to put in action the ASAP protocol, because at many cases at our perpetrator work, we faced challenges on child protection. So that was the case sometimes that we had to put the ASAP actions in place, and the protocol thereafter, of course, with victim support professionals or child protection professionals. And that was a very significant opportunity to introduce this process, this upscale process, this structured process, this organized process to professionals who were not so much aware about all this. For example, the child protection officers that were not so much into this spirit of multi-agency, for example. They were very much felt secured on the process. Child protection is a crucial element, I would say, a crucial factor to the process, that we need to ensure its the safety, and of course to have sustainable bottlenecks, like secured bottlenecks to the process, so to not to traumatize, to institutionally traumatize the welfare of the child. So I feel that child protection is a very significant paragraph to the chapter of ASAP.
Yeah, absolutely. Thank you, Nicolas. Laura, how was this element implemented in Italy?
Yes, so almost all programs for perpetrator of violence do not specifically provide support or activities for minors who are direct or indirect victim of violence. But we have to say that, however, at least 70% of the perpetrator in treatment are fathers of minors, sons and daughters. So our perpetrator program specifically addressed the issues of witnessed violence, the characteristic, the fact, etc., in one session of the psychoeducational group, and work on improving parenting and educational skill. Using the ASAP protocol, collaboration between professionals from perpetrator programs and victim support services is encouraged to establish partnership and to implement coordinated action for ensuring the safety and the well-being of children. We introduce also a specific section in the risk assessment checklist, the session B, the risk for the children, and a dedicated action plan that looks at protection and support needs, the action to take, and the agency responsible of that. The ASAP protocol foster interaction with public services dealing with children also. Indeed, when appropriate, victim support service and perpetrator program need to interact with social and healthcare services for the protection of minor, for example, such as child protection services.
Absolutely. And Emine, what was your experience in Naya?
Naya provides a service for children, victims, or witnesses of domestic violence. The challenge we identify is that if practitioners in victim support service are focused on protecting mothers and perpetrator program professionals work to correct fathers' behavior, there is a risk that children's needs are not addressed in any from both programs. In the ASAP protocol, there is an exclusive focus on the protection of children from violence, abuse, neglect, and re-traumatization. This focus is in the period before the start of the perpetrator program, but also while the perpetrator program is being implemented. In the risk assessment, there is a separate part related to the risk assessment for children. Last year, we implemented an initiative on child protection in perpetrator work. We conducted a national research of providers' practices in Bulgaria. We realized that this topic possesses several very important challenges. The first of these is that it is difficult for professionals to see the consequences of domestic violence on children, their specific experiences and needs. Practitioners are focused on protecting mothers, believing that this automatically protects children. The second is the unrealistic expectation of professionals that when a perpetrator enters the program, it automatically reduces the risk for children. Our experience, as well as the feedback from victims, show exactly the opposite. After the court decision on mandatory attendance at a program for perpetrators, the pursuit on children escalates and the danger for them increases. The perpetrator pursues, manipulates, and threatens them. For this reason, we have developed a specialized child protection policy and in the perpetrator program, which is different from the organizational one. The document specifically addresses the topic of child safety when working with their abusive fathers. We also developed 4 sessions that aim at improving fatherhood and raise the perpetrator's parenting capacity. Thank you.
Really good to hear that perspective, Emine. Thank you. And Emily, in Spavo, what would you like to add? What were specifics?
So the child protection is a very sensitive topic for us in SPAVO and in our perpetrators program because most referrals we get are about violence against children. That includes both direct violence towards the children or the children being the witnesses of violence. Unfortunately, the perpetrators program does not work directly with children, but we aim to minimize risk through the work with perpetrators that are also parents. It is important to mention that in Cyprus, when one of the parent or even both is a perpetrator, the authorities aim to give restrictive orders and remove the perpetrator from the house. But this is not something that is achieved in all times. And there are cases where the perpetrator continues to live with their children, which makes it harder for us in the program to know what is actually happening in their household. We cannot control it as easy. Also, we try to manage through our work with the perpetrators. We aim for them to understand that it has an effect on their children, even if they witness violence, because we noticed that after we started applying the ESA protocol and we started completing the impact toolkit, they weren't able to understand how, if the kids are presented, how they are affected. So we try to constantly psycho-educate them on the different forms of violence and the effect that it has on children. And as part of the interventions, we also talk about different communication and parenting skills that they can use when they want to communicate with their kids when they're in distress or when they're angry. And we also collaborate with the agencies that if a child has experienced in any way any form of violence, they go for a psychological assessment, and if needed, they go to a mental health professional to work with that distress. Yeah, and we check constantly with the services what's happening with the child once the perpetrator attends the program.
Thank you, Emily. Again, I think this really nicely outlines how, although we offer different services, and some organizations provide services for victims, some for children, some just for perpetrators, this is really relevant topic for all the organizations. And you mentioned how you integrated in your work through focusing on this in the work with your clients, but also how you build your internal capacities. And one of you mentioned child protection policy, and then again how you ensured the cooperation with different agencies. And again, to highlight that ASA protocol has integrated this aspect in its curriculum, including how to assess risks for children. Now we will focus on risks and continue. We know how important it is to continuously monitor risks when we work with domestic violence and then to manage these risks. So what were your experiences in integrating this element in your work while you were implementing ASAP? And Emine, I would start now from you, if that's okay.
Yeah. The updated ASAP risk assessment checklist is a part of our internal procedures. Thus, we compare the points of view of the perpetrator and the victims, including children. This is a key stage in coordinated case management. There is a challenge in multi-agency cooperation in risk assessment because different organizations use different tools. The police apply their own checklist. An algorithm for the judges is currently being developed. We need to ensure that we all have a common understanding of risk. We hope that this will happen after the adoption of national coordination mechanism for work on cases of domestic violence, which will soon be available in Bulgaria. The next key point in case management is the reporting of recidivism. During the implementation of the ASAP protocol, in a total of 12 cases, in half of them we had episodes of recidivism reported by the victims. We involved the police, the Child Protection Agency, a lawyer in the multi-agency meetings. Together with them, we planned the protection of the victims and we took actions the perpetrators to be accountable. As a result, after the end of the program, we had only one episode of recidivism reported by a victim. Last summer, there have been very dynamic processes regarding the changes in the Domestic Violence Protection Act. A national council was structured to coordinate policies in this area at the highest level. We participate in the expert group that advises this council to develop the first minimum standards for perpetrator program. So we hope to have better regulation and coordination in this area very soon.
Thank you, Emine. And Emily, what were your experiences?
For the importance of assessing and monitoring the risk, both the perpetrators and the victims of both services conduct a shared risk assessment adopted from the ASAP 2.0 protocol. Also, SPAVO organizes multi-agency cooperation meetings with the case managers of victim support services, the perpetrators program, and the external agencies such as police, social welfare services, Department of Ministry of Education, with the goal of cross-checking information, analyze a potential psychological or psychiatric report, completed after their mental health assessment, take safety measures for the kids and the women, and assess any possible risk presented. And for those completing the program, we use the recidivism checklist from the ESA protocol as we want to take recidivism measures. They're usually done after 3 months once a perpetrator is done with the program, and it can be done either in person or through a telephone session. And the same checklist is given to the victims, and then again we compare and cross-check results.
Yeah. Thank you, Emily. Nicholas, how did you implement risk assessment and management in Heraclio?
Risk assessment and case management were heavily introduced and somehow at a very intensive way. We think that risk assessment and case management are pivotal steps to the implementation, to the proper implementation of ASAP process. And actually, that was the case probably sometimes that very much level of engagement was taking place from other professionals. We segregate somehow the professionals that we work internally from victim side and perpetrator side, and we focus now on professionals that support women from other agencies or support children from other agencies together with our perpetrators program. And of course, this is a challenge for all to mainstream this process. And all professionals need to feel the need to work out more with risk assessment. And of course, it would be worthwhile to mention that if these police people were using this risk assessment, the last femicide that happened in Athens probably wouldn't take place. That's very strong, like proof that risk assessment is a very crucial step to the process of multi-agency. So we advocate for, we use, we try to push for using. We teach a lot. We have worked out, like back in 2023, more than 6 capacity building sessions for risk assessment to professionals of external ecosystem, police, law enforcement people, doctors, lawyers, social scientists, and see the need. We agree upon the need. So it's time to mainstream all these processes.
Thank you, Nicholas. Emily? Emine, sorry.
About the question, or?
Yes, what was the situation?
I already said it. Maybe Laura should say it
Okay,
also.
I apologize. I got confused, Laura.
Okay, so we have integrated all the tools with specific items regarding digital violence and witnessed violence. And also we introduced the implementation of a comparative risk assessment at different stage of the process. This integration represents an additional layer of security for women victims of violence, providing them with timely and continuously updated information. The initial results have shown that not only does the risk tend to decrease during the application of the protocol, but also that the risk assessment, which may have initially varied between victim support center and perpetrator program, eventually align. And this alignment demonstrates that the effectiveness of sharing information throughout the process, leading to the development of an operational plan with specific action. Another important aspect of the protocol is represented by the case management and work plan tool that allow professionals to track all information exchanged during meetings and to agree on a common work plan with clear indication on the action and task. This step is crucial as it allows for a stranger collaboration and a feeling of joint responsibility in the situation.
Thank you, Laura. It seems that the common thing is that there is really a need to have information from different sources as much as you can. And also multi-agency work is so crucial both in risk assessment, but also child safeguarding and online violence. So it again is the highlight of today's panel. Thank you to all the panelists, and this is an invitation to all participants to pose any questions that you have, general or to a specific panelist in the chat. And meanwhile, we could hear that the project indeed had a really good impact in all your countries and all your local communities. However, the project is finalizing now. So that's always a critical moment. Will the cooperation continue or it's not going to continue? So what are your plans to ensure that everything that you have achieved through ASAP and the multi-agency collaboration that you have developed still exists after the project ends? And anyone can take the question who feels inspired.
If you may, can I? Actually, all the ASAP process is a part of our multi-agency center that we try to develop at the context of the Family Justice Center in Crete that we have organized back in June 2023. Of course, the ASAP process and the ASAP tools are tools that we promote to our local interscientific committee, I would say, yet, not a multi-agency committee yet, comprised by the local prosecutor, police, academia, and external agents that work with either the perpetrator or the victim. And we do believe that ASAP, the ASAP process aims to standardize the processes at local level, like to standardize somehow the steps and to formalize a concrete like a roadmap for multi-agency. So we're very optimistic, and we feel that this, and of course we are in contact with all our partners at the ASAP through the networks that we participate and through informal or formal networks that we hold. We believe that it was a very impactful project anyways.
Yeah, thank you, Nicholas. It's good to hear optimism, and this means that the investment was worth it because now it can be sustainable. Is there anyone else who would like to comment on this question?
I think that I can say that we are optimistic too. As I say before, a lot of several victim support center ask us to receive the protocol. So we take that as a sign of we want also to continue the collaboration. So we for sure will continue to propose the protocol in the situation when we can use it. And another thing is that we want to improve the collaboration with the third part. So probably with social services or other actor that could be involved in the process.
Yes. It's also good to hear that you have positive expectations and they already made some steps how to make this cooperation sustainable. I would like now to thank all the presenters. It was indeed really interesting to hear your experiences in different local communities, but also a lot of motivation that was coming from all the presenters. It was really obvious that this is a topic that is important for you personally, for your organization, and probably this is the value that then you transmit also to other stakeholders. We could hear from many of you how sharing the common goals and values is important for this multi-agency work. I would now like to invite Elena Gaiotto to close the event.
Yeah, so I just wanted to say a few words. So first of all, thank you all for joining the event today. I think it was really great and really interesting to hear this different perspective, both from the other projects, but also from you participants. I also would like to thank all the project partners that have worked alongside with me for 2 years, and it's been quite an adventure. And last but not least, I would like to thank Sandra for the amazing moderation of this event, and Durre, who's hiding behind the WWP logo, for the brilliant tech support, and Dimitra for the great effort in putting this up. So thank you all for supporting me in the project, and thank you for being here.
It's really an important period in the whole process. You're ending a really big project and you're ending it successfully. So it's definitely time for a celebration. Thank you to all project partners, all participants. It was a pleasure to meet with you today, and we will stay in touch for different activities that all of you and us are doing and exchanging that always helps us to build a stronger future. So have a good day and see you in one of our next events.